Welcome back, everyone, to the Deep Dive.
Yeah.
Today, we're going to be looking at something pretty interesting, I think, that you might actually encounter during a medical emergency.
Oh, yeah.
It's the Ambulance Call Report,
Okay.
or ACR.
The ACR.
You've sent us some excerpts about its design,
Mm-hmm.
so let's sort of decode it a little bit and see what makes this thing tick.
Absolutely.
I guess maybe for folks who aren't familiar,
Sure.
what is an Ambulance Call Report?
Well, basically, it's a document
Yeah.
that paramedics use to record all the information, during an emergency call.
So everything that happens.
Every vital piece of information is recorded on this document.
So it's like a medical mystery novel.
Yeah.
Each section reveals a clue
Precisely.
about the patient's condition
Yeah.
and the care they received.
That's a great analogy.
Now,
yeah.
this source mentions that the ACR is organized into 9 sections.
Okay.
9.
Yeah.
That seems like a lot to handle in the heat of the moment.
It does.
How do paramedics actually use this in the field?
Right.
I mean, is it ever a hindrance?
Well, it's true. 9 sections is a lot.
Yeah.
But there's a method to the madness.
Okay.
There's a clever logic behind it.
Right.
The first 5 sections that appear on the front of the ACR,
Okay.
demographics, clinical information, physical exam, treatment procedures and results, and general administration.
Okay, so those first 5.
Those first 5 actually mirror the flow of an emergency call.
So it's like a timeline.
It is like a timeline.
From a moment the paramedics arrive
Yeah.
to the station handover.
Precisely.
Okay.
So this chronological order,
Yeah.
it helps paramedics document everything in a clear step-by-step way.
Mm-hmm.
And that reduces the risk of missing any vital information.
Yeah. Now, that chronological order
Yeah.
seems very logical.
Yeah.
Could there be any downside to that?
Well,
I mean, could it ever lead to overlooking information?
that's a great question. And it's something that researchers are looking at all the time.
Mhm.
While the ACR is designed to be comprehensive,
Yeah.
there's always a chance
Yeah.
that there could be some human error.
Especially in those
Sure.
high-stress situations.
Absolutely high-stress situations. So
Yeah.
that's why ongoing training is so important.
Right.
And quality improvement initiatives
Yeah, makes sense.
in EMS.
Okay, so we talked about the front.
Right.
The reverse side of the ACR has 4 sections. Codes, reference information, aid to capacity evaluation, and refusal of service.
Okay.
These seem more like separate tools.
They are.
Yes.
They're sort of like specialized tools
Yeah.
that support the main narrative on the front.
Okay.
For example, the codes section might seem like
A bunch of gibberish.
just a bunch of numbers and letters.
Yeah.
But it's really important.
Okay.
It's kind of like a secret language that researchers use
Okay.
to analyze trends in emergency care. Imagine you're trying to compare thousands of ACRs,
Right.
and they all have different wording.
That would be a nightmare.
It would be a nightmare. But with standardized codes,
Okay.
we can analyze the data much easier,
Yeah.
spot patterns,
Yeah.
and ultimately improve patient outcomes.
So it's kind of a universal language.
Yeah, it is. It is.
Okay, that makes sense.
Mm-hmm.
The reference information section also sounds incredibly useful.
It is.
What are some situations where this would be a lifesaver for paramedics?
Well, let's say, for example, a paramedic is responding to a call
Okay.
involving a newborn baby.
Okay.
Now, they might not deal with newborns every day.
Right.
So having quick access to pediatric vital sign parameters, pain scales,
Okay.
and things like the APGAR score
Yeah.
can be really invaluable.
So what is the APGAR score?
The APGAR score is basically a quick assessment of a newborn's health.
Okay.
It looks at things like heart rate,
Mm-hmm.
breathing, and muscle tone. Each of these factors receives a score,
Okay.
and then the total score
Yeah.
helps doctors decide if a baby needs immediate attention.
Wow, that's
Yeah,
really something.
it is.
I mean, it's amazing how much thought goes into something like this,
Right.
you know?
Yeah, absolutely.
Yes, clearly.
Well, the ACR is designed to be
Yeah.
as comprehensive as possible,
Yeah.
but it's not just about quantity.
Right.
It's about the quality of information, too.
Now, our source mentions that the ACR uses prompts and ghosted scripts.
Yeah.
What are those?
Okay, well, these are subtle design elements
Okay.
that are meant to streamline documentation
Okay.
and reduce cognitive load on paramedics,
So, for instance.
like checkboxes
Okay.
that allow paramedics to quickly mark common findings.
Yeah.
So that saves valuable time
Right.
and mental energy,
Especially in those situations.
especially in high-pressure situations.
I'm sure we've all filled out forms
Yes.
that feel like pulling teeth.
Absolutely.
But This ghosted script idea for dates and times seems pretty clever.
It is.
I mean, imagine trying to scribble a date legibly
Yeah.
while you're bouncing around in the back of an ambulance.
That's right.
Yeah.
So these ghosted scripts ensure consistency,
Right.
minimize errors,
Yeah.
and make the records easier to interpret
For everyone involved.
for everyone involved
Okay.
in the patient's care.
And what about the refusal of service section?
Right.
Something a bit of a downer.
Well, it's incredibly important. You
Yeah.
know, imagine a situation where someone refuses treatment,
Right.
even if paramedics think it's necessary.
Yeah.
This section ensures that everything is documented, carefully protecting both the patient and the paramedics.
And what about the aid to capacity evaluation?
Right.
section?
So this is used when
Yeah.
a patient might need to be assessed for mental health concerns.
Okay.
So it helps guide paramedics in gathering the necessary information
Yeah.
to make informed decisions about that patient's care.
This has been really insightful.
Oh, good.
Who knew there was so much thought
Yeah.
put into the design of an ACR?
It's really a meticulously crafted tool,
Yeah,
balancing thoroughness with ease of use.
absolutely.
Yeah, and it really reflects a fundamental principle of emergency medicine,
And what's that?
that clear, concise communication is paramount
Yeah.
for effective patient care.
Yeah?
Every box checked,
Right.
every code recorded
Yeah.
contributes to a patient's journey
To recovery.
toward recovery.
So next
Yeah.
time you see an ambulance speeding by,
Yeah,
remember the ACR
that's right.
quietly working behind the scenes,
Yeah,
documenting the drama,
absolutely.
and ensuring the best possible outcome for the patient.
And it's important to remember that the ACR is just one piece
Yeah,
of a very complex puzzle.
of course.
It takes skilled paramedics, effective communication, and a coordinated healthcare system
Right. To really save lives.
to truly save lives.
Well, that's all the time we have for today's deep dive into the anatomy of an ACR.
Yeah,
We hope you found this exploration informative,
we did too.
and we'll see you next time
See you next time.
on The Deep Dive.
Bye.
Ever get the feeling like there's this whole secret language out there? You know, codes and abbreviations that only a select few really understand.
Right, like a secret society.
Exactly.
Yeah.
But what if that language was about your health, your community, even the future of emergency medicine?
Now that's intriguing.
Today, we're cracking the code of ambulance call reports, or ACRs.
Oh, ACRs. Think of them as like a paramedic's version of a detective's notebook.
Oh, okay.
Every little detail, every observation, every single decision meticulously documented. It forms this detailed narrative of every single emergency call.
So we're talking more than just patient names and addresses, right?
Yeah.
There's got to be more to it.
Absolutely. These reports, they go so much deeper. Imagine like a multi-car accident.
Oh, yeah.
Pure chaos,
Yeah.
multiple injuries, decisions that need to be made in seconds, right?
Yeah.
So the ACR helps paramedics navigate all that chaos. It ensures every patient receives the right care in the right order.
So how do paramedics decide who to treat first in a situation like that? It's not like they have time to, draw straws or something.
Yeah, exactly. That's where the concept of triage comes in. It's a system for rapidly assessing and prioritizing patients, based on how severe their condition is. And the ACR captures this whole process. So the most critical patient, they're always designated as sequence 1.
Sequence 1. Got it.
It's a system designed to bring order to even the most chaotic scenes.
Okay, that makes sense. But what about the less dramatic but equally important details? Like what else is hidden in these reports?
Well, consider the warning systems and call events sections.
Okay.
Filled with timestamps for everything. Sirens activated, arrival at the scene, even the moment patient contact is made. You might be wondering why such meticulous timekeeping.
Yeah, it seems like every second would count in those situations.
Yeah.
Does all that documentation really matter when you're dealing with a life or death situation?
It really does. Those timestamps, they're more than just, bureaucratic check marks.
Right.
They become crucial pieces of data.
Oh.
They allow us to reconstruct events, analyze response times, even identify potential bottlenecks in the system.
I see.
For instance, imagine a delay between, say, depart scene and arrive destination.
Wow.
It could point to traffic congestion or a necessary detour, highlighting areas where emergency response routes could be improved.
It's like detective work, but for emergency response systems.
Exactly.
Fascinating. So we've got triage, timestamps. What else? Walk us through some more of these ACR sections.
Well, let's move on to the patient and sequence fields. Imagine a scenario with, say, a multi-car accident.
Right. Lots of potential injuries, varying levels of severity. How do paramedics sort through all that information on the fly?
That's precisely where the sequence notation becomes critical. It goes beyond just listing patients. It establishes a clear hierarchy based on the severity of their conditions. Sequence 1, like I mentioned before, always the most critical. Then sequence 2 and so on. This whole system ensures everyone receives appropriate care, even amidst the chaos.
That makes sense. It's a system designed for clarity and efficiency, even under extreme pressure.
Exactly. And the ACR, it goes beyond just recording the sequence. It delves into the specifics of each patient's condition, capturing vital signs, initial assessments, and the treatments administered on scene.
So each ACR paints this detailed picture, not just of the event itself, but of the individual journeys of each patient involved.
Precisely. It's a tapestry of information woven together through careful observation and documentation.
Wow.
And these individual threads, when they're analyzed collectively, they can reveal much larger patterns and insights.
Now you've really got me hooked.
Yeah.
What kind of insights can we glean from these reports when we zoom out to the bigger picture?
Well, consider the aid to capacity assessment section on the back of the ACR.
Okay.
This is where things get particularly intriguing.
Okay, now I'm really intrigued. Tell me more about this aid to capacity assessment section. What's its purpose?
This section, it's all about ensuring patients are truly informed and they're able to make decisions about their own care. Oh, okay.
Even in the midst of, a stressful emergency.
That sounds challenging. How do paramedics assess a patient's capacity to make those decisions?
Well, it starts with careful observation and communication.
Right.
Paramedics, they're trained to look for signs of confusion, pain, or intoxication. Anything that might impair a patient's judgment.
I can see how that would be a tricky assessment to make, especially in a high-pressure situation. What kind of questions are paramedics asking to gauge a patient's understanding?
They might ask simple questions like, do you know where you are? Or can you tell me what happened? But it goes deeper than that.
Okay.
They're also assessing the patient's ability to understand the potential consequences of their decisions, particularly if they're considering refusing treatment.
Ah, that brings us to the refusal of service section. What happens when a patient decides against receiving treatment, even when it seems like they need it?
This is where the ACR's role in protecting both patients and paramedics becomes especially important. So it's more than just a patient saying, no thanks, and everyone moving on.
Much more. When a patient refuses treatment, there's a meticulous documentation process that kicks in.
Okay.
It involves signatures, witnesses, and detailed notes explaining the situation, the risks and benefits discussed, and any alternative options offered.
Oh, wow.
It's about transparency and accountability, ensuring everyone's on the same page.
So even in those moments of disagreement, the ACR serves as a tool for communication and clarity.
Precisely. And remember, even when a patient refuses service, paramedics don't just walk away.
Right.
They're trained to educate patients, address concerns, and offer alternative care options whenever possible.
I see.
The goal is always to provide the best possible care, even when that care isn't accepted.
It's a fascinating balance of respecting a patient's autonomy while also ensuring their well-being.
And the ACR helps navigate that delicate balance, providing this framework for ethical and informed decision-making in some of the most challenging circumstances imaginable.
I'm starting to see how these reports are so much more than just paperwork. They're a window into a world of split-second decisions, complex medical assessments, and a constant balancing act between patient autonomy and safety.
You're absolutely right. And you know what? We've only just scratched the surface. There are layers upon layers of information embedded within these reports,
Oh,
just waiting to be explored.
sounds like we've got a lot more ground to cover. We'll be back soon to delve deeper into the world of ACRs. Don't go anywhere. We're back and ready to delve deeper into those layers of information you mentioned. What else can we learn from these ACRs?
Well, remember how we talked about those timestamps being crucial for analyzing response times?
Yeah, it's like having this precise timeline of the entire emergency response.
Exactly. But it's not just about when things happened, it's also about where.
Okay.
The ACR, it includes a section for location type, and that goes beyond just a street address.
Okay, so we're talking more than just 123 Main Street. What kind of detail are we getting here?
Think about the different environments where emergencies can occur. A private residence, a bustling public park, a busy highway, even a nursing home.
Right.
Each location presents unique challenges and risks.
Right. A medical emergency at a concert venue is going to require a different approach than one at somebody's home. But how does that level of detail actually improve emergency response?
Let's say there's a noticeable increase in calls originating from a specific location type. like nursing homes, for instance.
Good.
Analyzing this data could reveal like underlying issues, maybe a lack of preventative care or safety measures within those facilities.
Oh, I see.
It could even lead to targeted interventions like fall prevention programs or improved staff training.
So it's about connecting the dots between individual calls and broader public health trends.
Yeah.
That's fascinating. What other details are captured in this location section?
Well, paramedics also document the mechanism of injury or the nature of illness.
Okay.
Was it like a slip and fall, a car accident,
Right.
a heart attack?
Ah, so we're getting to the root cause of the emergency. Why is that level of detail so important?
It allows researchers to track trends, identify high-risk populations, and develop targeted prevention strategies.
Okay.
For example, if data shows a spike in bicycle accidents involving head injuries, it could lead to campaigns promoting helmet use, or even infrastructure improvements to make bike lanes safer.
It's amazing how these individual reports can contribute to such large-scale impact.
Exactly. And that's not all. Let's go back to that aid to capacity assessment section we touched on earlier.
The one about determining if a patient is capable of making decisions about their own care.
That's the one. It's a crucial aspect of ethical and responsible patient care. And the ACR, it provides this framework for navigating this often complex process.
You mentioned that paramedics look for signs of confusion or intoxication, but how do they actually determine a patient's capacity in those critical moments?
Well, think of it as like a mini mental status exam right there on the scene.
Okay.
Paramedics are trained to ask specific questions, to gauge a patient's understanding of their situation and their ability to make informed choices.
Can you give me an example of what those questions might sound like?
They might ask, do you understand why we're here? Or can you explain the risks of refusing treatment?
Okay.
They're looking for clear and coherent answers, ensuring the patient isn't simply agreeing or disagreeing without truly grasping the implications.
So it's more than just asking, do you want treatment? It's about making sure the patient can weigh the options and make a truly informed decision. What happens if they can't?
That's where things can get tricky.
Right.
Ideally, there's a family member or someone with power of attorney who can step in as a substitute decision maker.
Oh, okay.
But if not, paramedics have to act in the patient's best interest, even if it means providing treatment against their initial wishes.
That sounds like a heavy burden to bear, especially in a high-pressure environment.
It is, and that's why the ACR is so important. It provides this detailed record of the assessment, the questions asked, the patient's responses, and the rationale behind any decisions made.
I see.
It helps ensure transparency and accountability, protecting both the patient and the paramedics involved.
I'm starting to see how these reports go far beyond simple documentation. They capture a world of ethical considerations, split-second judgments, and the constant pursuit of providing the best possible care, even in the most challenging circumstances.
Exactly. And there's one more fascinating aspect of ACRs that I think you'll find particularly intriguing.
Okay, don't leave me hanging. What else is hidden in these reports?
Well, tucked away at the end of the ACR is a section simply labeled Narrative.
Ooh, now we're getting to the good stuff. What kind of stories do these narratives tell?
This is where paramedics get to step outside the structured format of the report
Okay.
and share their observations and experiences in their own words.
Wow.
It's where the human element of emergency care truly shines through.
So it's like reading the personal log of a first responder, getting a glimpse into their world.
Precisely. You might find descriptions of, challenging patient interactions, unexpected obstacles encountered on scene,
Yeah.
or those small moments of human connection that make all the difference.
I bet there are some incredible stories of courage, compassion, and quick thinking hidden within those narratives.
Absolutely. And they remind us that behind every ACR, there are real people facing real challenges.
Right.
Paramedics, patients, families, they're all part of this complex tapestry of emergency care.
It's incredible to think that these reports capture not only the medical details, but also the human stories woven into each emergency response.
And those stories, often hitting within the seemingly dry language of the ACR, offer this glimpse into the heart and soul of emergency medicine.
Well, this deep dive has certainly opened my eyes to the complexities and nuances of these reports. We've explored triage, timestamps, location data, capacity assessments, refusals of service, and now these personal narratives. What else is there to uncover?
Believe it or not, there's still more to explore. We've only just scratched the surface of how these reports contribute to research, quality improvement, and ultimately, a better understanding of emergency medicine as a whole.
Sounds like we need to gear up for another round of exploration. We'll be back soon to uncover those final layers of insight. Stay tuned. We're back, ready to uncover those final layers of the ACR you mentioned. What else can these reports tell us about the world of emergency medicine?
Well, we've talked about how ACRs, they capture those intricate details of individual emergencies, right? The who, the what, the when, the where. But their true power, it lies in what happens when we zoom out and we look at these reports, collectively.
Okay, so we're moving from individual stories to the bigger picture. What happens when we start analyzing all of these reports together?
Think of each ACR as like a data point.
Okay.
A piece of a much larger puzzle. When researchers analyze these reports en masse, they start to see patterns emerge. Trends in injury types, high-risk locations, even the effectiveness of different treatment protocols.
So each report contributes to this deeper understanding of emergency medicine as a whole.
Exactly. For example, researchers might analyze ACRs to study the long-term outcomes of patients who suffered, say, a particular type of injury. Or they might use the data to evaluate the effectiveness of a new pre-hospital treatment protocol.
It's amazing to think that something as seemingly simple as a report filled out by paramedics can have such a profound impact on research and ultimately patient care.
It really is. It's a testament to the power of data, especially when it's collected systematically and analyzed with a keen eye. And speaking of data, there's one final piece of the ACR puzzle I want to highlight, the section labeled Other.
Other. That sounds pretty vague.
Yeah.
What kind of information gets tucked away in that category?
This is where paramedics can document anything that doesn't fit neatly into the predefined categories of the report. It's a space for, those observations, those nuances
Okay.
that might not seem significant at the time, but could hold valuable insights.
Can you give me an example of what kind of information might end up in the other section?
Imagine a paramedic responding to a call involving an elderly patient who lives alone. They might note that the home is cluttered and unsafe, posing a fall risk. Or they might observe signs of neglect or social isolation.
So it's about capturing the context surrounding the emergency, those factors that might not be directly related to the medical condition, but could influence a patient's overall health and well-being.
Exactly. And this information, while seemingly anecdotal, can be incredibly valuable when analyzed on a larger scale.
Oh, okay.
It can shed light on social determinants of health, identify populations in need of additional support services, and inform the development of community-based interventions.
It's like piecing together this mosaic, with each ACR contributing a small tile to a much larger and more complex picture of health and well-being in our communities.
That's a great analogy. And it's a reminder that emergency medicine is about so much more than just, treating immediate medical needs. It's about understanding the interconnectedness of health, social factors, and the environment.
Well, you've certainly taken us on this fascinating deep dive into the world of ACRs. We've gone from codes and timestamps to research and social determinants of health. Who knew there was so much depth hidden within these reports?
It's been a pleasure sharing these insights with you, and I hope our listeners, now have this newfound appreciation for the power of these reports, not just as documents of individual emergencies, but as valuable tools for shaping the future of emergency medicine and improving the health of our communities.
Next time we hear those sirens wailing, we'll know that there's more to the story than meets the eye. A story being meticulously documented, analyzed, and ultimately contributing to a deeper understanding of health, risk, and resilience in our world.
Well said. And remember, these reports are a testament to the dedication, the skill, and the compassion of the paramedics who are out there on the front lines every day, making a difference in people's lives.
Thanks for joining us on this deep dive into the world of ACRs. It's been an eye-opening journey, and we hope you'll join us again soon as we explore other fascinating corners of the world around us.
Welcome to the Deep Dive. Today, we're going to be looking at pre-hospital care.
Okay.
And we're doing it through a pretty unique lens, the ambulance call report, or ACR.
Right.
I got to say, when I first got my hands on this manual, all the codes and instructions, it felt a little bit like I was trying to decipher a secret language.
It can seem that way at first glance.
Right.
Yeah, but these codes and instructions, they're actually vital for ensuring clear communication and patient safety.
Oh, absolutely.
In emergency situations.
Yeah.
What may appear dry on the surface is actually a treasure trove of information about what paramedics do and the challenges they face.
So let's unpack this. First off, can you give us the big picture?
Yeah.
What exactly is this ambulance call report?
So the ACR is like a detailed journal entry for every ambulance ride.
Okay.
It's a standardized form used by paramedics across Ontario to capture the essential details of each call. Patient information, the nature of the emergency, the treatment, provided everything from dispatch to the handover at the hospital.
And you emphasized standardized.
Right.
Why is that so crucial in pre-hospital care?
So standardization is key for a few reasons.
Okay.
It ensures that everyone involved in the patient's care, from the paramedics on scene to the receiving hospital staff, is working from the same playbook.
Right.
This clear communication is vital
Okay.
for patient safety and continuity of care.
Yeah.
Imagine the chaos if every paramedic team
Oh, yeah.
used their own unique system.
Oh, it would be a mess.
Right.
So it's like having a universal language
Exactly.
for emergencies.
Yeah.
Speaking of which, I noticed the manual mentions both paper and electronic ACRs.
Yes.
Is that part of this standardization effort?
Absolutely.
Okay.
We're seeing a big shift toward electronic ACRs
Mm-hmm.
or EACRs.
Right.
It's a game changer for data collection and analysis.
Really?
Think about it.
Okay.
EACRs allow for real-time data entry, reducing errors and providing instant access to patient information.
Yeah.
This not only improves efficiency,
Okay.
but also helps identify trends, evaluate treatment protocols, and inform public health initiatives.
That's fascinating. It's like taking a pulse on the health of our communities through these reports.
Yeah.
So to really dive into the nitty-gritty,
Yeah.
let's focus on one specific section of the ACR,
Okay.
the section details.
Okay.
What kind of information is captured in this section?
So section details is where the patient's story really unfolds.
Okay.
We get a detailed snapshot of who they are,
Mm-hmm.
where they were picked up, the nature of the emergency, and the initial steps taken to provide care.
I noticed that there are a lot of individual fields within this section. It's pretty comprehensive. Is it really necessary to capture that much detail?
You know, every piece of information, even seemingly small details, can play a crucial role in a patient's care.
Okay.
For example, the instructions for describing the pickup location are incredibly specific, especially for highway incidents.
Why such precision? Is it just about getting the ambulance there faster?
It's about more than just speed.
Yep.
Accurate location information allows for efficient dispatching coordination with other emergency services, like air ambulances,
Yeah.
and seamless transfer of information to the receiving hospital.
Wow.
It can literally be the difference between life and death in some
That
cases.
still makes a lot of sense.
Yeah.
So let's break down some of these fields in section details.
Sure.
What's the first piece of the puzzle we encounter?
So the first field we encounter is the hospital registration number,
Okay.
which links the ACR to the patient's hospital record,
Oh, okay.
ensuring a smooth transition of care.
Seamless information flow.
Right.
Then we have service name and service number, which I'm guessing identifies the specific ambulance service and crew that responded.
Exactly.
Okay.
It's about accountability and tracking resources.
Okay.
Then, to keep things organized, we have the CACAX and call number. That's the dispatch center and the unique identifier for each call.
So we've set the scene. We know who's involved. Now let's get to the patient themselves.
Right. We start with the basics: last name, first name, and critically age.
Hold on, age. I mean, it seems pretty basic, but why is it so critical in this context?
So age is more than just a number.
Okay.
In emergency care.
Right.
It's a key factor in determining appropriate treatment protocols and medications. For example, a dose of medication that's safe for an adult could be harmful to a child.
Yeah, of course.
And the ACR gets really specific here.
Okay.
If the patient is an infant, their age is recorded in days.
Okay.
For children under 2 years, it's in months.
Got it.
And for everyone else, it's in years.
Okay.
This level of precision is especially crucial when dealing with young patients,
Yeah.
where even small variations
Yeah.
can make a big difference.
Wow, I hadn't thought about it that way. It's amazing how even the seemingly simple things have this extra layer of significance in pre-hospital care. What comes next?
So after age, we have sex, followed by weight in kilograms. Again, these are seemingly simple details
Right.
that have big implications for dosage calculations and treatment decisions.
Especially in emergencies where time is of the essence.
Exactly.
Then to round out the patient's basic information, we have their date of birth and health insurance number.
Precisely. And speaking of the health insurance number,
Yeah.
there's an interesting detail here that might surprise you.
Oh, you tell.
There's a specific entry called CNO, which stands for Code Not Provided.
Okay.
It's used when a patient can't or won't give their health insurance number.
Okay.
And this small detail can actually raise some big questions
Interesting.
about healthcare access and equity.
Here's where it gets really interesting. How so?
Well, imagine a situation where someone needs emergency care but doesn't have or can't provide their health insurance information.
Right.
That raises concerns about their access to care
Hmm.
and potential barriers they might face.
That's a really important point. It's like this tiny detail in the ACR is flagging a much larger issue within the healthcare system.
Yeah.
It makes you think about how we can use this data to advocate for better access for everyone.
Exactly. And this is just one example of how the ACR goes beyond simply documenting an event.
Yeah.
It becomes a tool for understanding broader social and systemic issues.
Okay, so we've got the patient's basic info down. What's next? Do we finally get to the emergency itself?
We're getting there. The next field is the patient's mailing address.
Okay.
And while that might seem straightforward, even here we see how the ACR highlights potential vulnerabilities.
Okay, I'm intrigued. How can an address reveal vulnerability?
So if a patient has no fixed address, paramedics are instructed to specifically enter no fixed address.
Okay.
This, like the CNO entry, can point to challenges in accessing healthcare for individuals experiencing homelessness or unstable housing.
Wow.
It's another example of how these seemingly simple data points can tell a much larger story.
I'm really starting to see how much information is packed into this form.
Yeah.
And finally, we arrive at the pickup location or sending facility.
Yeah.
The scene of the emergency.
Exactly. This is where the action unfolds, and the instructions for this field are incredibly specific.
Okay.
For instance, if the pickup is on a highway, paramedics need to provide the highway number and the exact kilometer marker nearest to the incident.
That's hyper specific. It's like they're trying to pinpoint the location on a map. Why so much detail?
In emergency situations, every second counts.
Yeah.
Precise location information is vital for coordinating a rapid and effective response.
Right. It's not just about getting the ambulance there quickly. It's about orchestrating the entire emergency response network.
Absolutely. And to streamline this process even further,
Okay.
the ACR uses a system of pickup codes.
Okay. More codes. What do these tell us?
So these codes categorize the type of location where the patient was picked up.
Okay.
So instead of writing out single-family residence, paramedics can simply use the code A. It's all about efficiency and quick communication.
Ah, so it's like a secret language that helps get things done faster.
Exactly.
But I imagine there are times when these predefined codes don't quite fit the situation, right?
You're exactly right. That's where the remarks section comes in.
Okay.
If a pickup location doesn't neatly fit into one of the established codes, paramedics can use code Z for other
Oh, okay.
and then provide a detailed description in the remarks section.
So it's a system that balances standardization with the flexibility to capture the unique details of each call. Pretty clever, actually.
Right.
And speaking of unique details, there was something about hotels that caught my eye.
Ah, yes. The guidelines for hotel pickups highlight how the ACR focuses on the objective where rather than the subjective why.
Okay, I'm not sure I follow.
Well, the code for a hotel pickup is always G,
Okay.
regardless of whether the patient was a guest, an employee, or simply passing through.
Oh, interesting.
It's about creating a clear and impartial record of the location, leading the interpretation and analysis for later stages of the care process.
That's fascinating. It really emphasizes the importance of objective documentation in emergency care. And it makes you realize just how much thought goes into designing these forms.
Absolutely. And we've only just scratched the surface of section details.
This is already more interesting than I expected. We'll definitely need to take a deeper dive into those other details. But for now, let's take a quick pause and we'll come back soon to explore more of this fascinating world of pre-hospital care documentation.
Sounds good.
Welcome back to the deep dive. We're continuing our exploration of the ambulance call report, and I have to say I'm starting to see these forms in a whole new light.
It's amazing how much information is packed into these seemingly simple documents, right?
Yeah.
Each field is carefully designed to capture a specific piece of the puzzle. And when you put it all together, you get a really comprehensive picture of the emergency situation.
Exactly. And as we continue through the section details, I'm curious to learn more about how this information is used to guide treatment decisions and coordinate the entire emergency response.
Well, the next field we encounter is destination hospital,
Okay.
which, as you might expect, identifies where the patient is being transported.
Right.
This is crucial for coordinating care between the paramedics and the receiving hospital staff.
Right. It's all about that seamless handoff from one care team to the next.
Yeah.
But what about situations where the patient's condition is really critical? How do they prioritize who needs immediate attention?
That's where the priority code comes in.
Okay.
This code indicates the urgency of the call based on the patient's condition
Okay.
and helps hospitals prepare for the incoming patient and allocate resources accordingly.
So is it like a triage system where a higher priority code means a more life-threatening situation?
Exactly. It's a way of quickly communicating the severity of the situation and ensuring that the most critical patients receive immediate care.
It's fascinating to think about all the behind-the-scenes coordination that's happening based on these codes.
Absolutely. It's like a well-choreographed dance with everyone playing their part to ensure the patient receives the best possible care. And just like in a dance,
Yeah.
timing is everything.
Right.
That's where the next few feels come in.
Okay.
Time arrived at scene,
Okay.
time departed scene, and time arrived at destination.
Wow. They're really tracking every minute. Why is it so important to be that precise with the timestamps?
So these timestamps are more than just a chronological record.
Okay.
They provide valuable data for analyzing response times,
Yeah.
identifying bottlenecks in the system, and ultimately finding ways to improve the efficiency of pre-hospital care.
Okay.
For instance, if data shows that response times are consistently longer in a particular area, it might indicate a need for additional resources or a different approach to dispatching.
So it's not just about documenting what happened, it's about using that information to make things better in the future.
Exactly. It's about continuous improvement and striving to provide the best possible care for every patient. Now shifting gears a bit.
Okay.
Let's talk about the reason for the call.
Mm-hmm.
This is where we encounter a system called CMSIS,
Huh?
the Canadian Emergency Medical Services Information System.
Okay. SEMTHIS, that sounds pretty important.
It is.
What is it exactly?
So TMSIS is a standardized system used across Canada to categorize and code the reason for an ambulance call.
Okay.
It's like a universal language that allows paramedics to communicate clearly and effectively regardless of where they are in the country.
That makes a lot of sense, a shared language for emergencies, but how does it actually work? How do they categorize the reason for the call?
So CMSIS uses a combination of codes and descriptors to capture the nature of the emergency.
Okay.
These codes cover a wide range of situations, from respiratory distress and cardiac events to traumatic injuries and mental health crises.
Wow, it's pretty comprehensive. It must be incredibly helpful to have this standardized system in place.
Absolutely. It not only streamlines communication between paramedics and other healthcare providers,
Right.
but it also allows for valuable data analysis.
Yeah.
By tracking these codes over time, we can identify trends in emergency calls and use that information to inform public health initiatives, allocate resources effectively, and even develop targeted prevention programs.
So the ACR isn't just about individual patients.
Right.
It's about understanding the bigger picture of health and safety in our communities.
Exactly. It's like a pulse check on the well-being of our society. Now, moving on to the treatment section.
Okay.
This is where paramedics document all the interventions and medications
Okay.
they provided to the patient. It's a detailed record of every step taken to stabilize the patient and prepare them for transport.
So it's like a step-by-step guide to what happened during the ambulance ride.
Precisely. And this documentation isn't just for accountability.
Right.
It also serves as a valuable learning tool for paramedics and the entire healthcare system.
Yeah.
By reviewing these records,
Yeah.
we can identify trends in treatment approaches, evaluate the effectiveness of different interventions, and continually refine protocols to provide the best possible care.
It's amazing to think about all the knowledge and insight packed into these forms. It's like each one tells a story not just about the individual patient,
Yeah.
but about the evolution of emergency care itself.
You've hit the nail on the head. And as we delve deeper into the ACR,
Yeah.
we uncover even more fascinating details
Okay.
about how paramedics assess and manage patient care.
Well, I'm eager to hear more. But for now, let's take another brief pause, and we'll be right back to continue our deep dive into the world of the ambulance call report. Welcome back to the deep dive. We're in the home stretch of our exploration of the ambulance call report, and I have to say my appreciation for paramedics has grown exponentially.
It's eye-opening, isn't it, to see how much skill and knowledge
It really is.
they bring to each and every emergency.
Yeah.
And the sections we're about to explore really highlight that expertise. How they assess patients, monitor their vital signs, and make critical decisions
Yeah.
under pressure.
Okay, I'm all ears. Let's dive into these final sections.
All right, well, right after the treatment section, we come to vital signs.
Okay.
This is where paramedics meticulously record the patient's heart rate, blood pressure, respiratory rate, and oxygen saturation. It's like taking a snapshot of the patient's physiological state
Right.
at that moment in time.
Ah, the classic vital signs. It's like checking the gauges on a dashboard
Right.
to see how everything is running.
Exactly. These measurements provide crucial information about the patient's overall condition and help paramedics track changes over time,
Yeah.
which can be vital in guiding treatment decisions.
Right.
For example, a sudden drop in blood pressure
Yeah.
could indicate internal bleeding, while a rapid heart rate might suggest shock or distress.
It's amazing how much these numbers can reveal about what's happening inside the body.
Absolutely. And then we have the Glasgow Coma Scale.
Okay.
This is a globally recognized tool used to assess a patient's level of consciousness,
Mm-hmm.
especially in cases of head injury or other conditions affecting brain function.
I've heard of the Glasgow Coma Scale. It's always featured in medical dramas.
Right.
But can you give us a breakdown of how it actually works?
It's actually quite straightforward. The scale assigns points based on 3 key responses:
Okay.
eye-opening, verbal, and motor.
Okay.
The lower the total score, the more severe the impairment of consciousness.
Right.
So a patient who is fully alert and responsive would score a 15,
Okay.
while someone in a deep coma would score a 3.
So it's a quick and standardized way to communicate the severity of a head injury.
Precisely. And that standardized approach continues with the pupil assessment.
Okay.
Here, paramedics carefully document the size and reactivity of the patient's pupils to light.
So the pupils aren't just about letting in light, they're also a window into the brain's activity.
Exactly.
Mm.
Changes in pupil size or reactivity can be early signs of a brain injury, increased intracranial pressure, or even drug overdoses. It's a subtle but powerful indicator that paramedics are trained to recognize and document.
I never realized how much could be learned from something as simple as looking at someone's pupils.
It's all about connecting the dots and looking for patterns, and that's what makes paramedics so good at what they do.
Right.
They're constantly gathering information, analyzing it, and adjusting their approach based on what they find.
Speaking of gathering information, the next section focuses on blood glucose level. Is this standard procedure for all patients?
Not necessarily.
What?
This field is primarily used for patients with diabetes or other conditions that affect blood sugar regulation.
Okay.
Having an accurate blood glucose reading can be crucial for guiding treatment decisions and preventing complications.
So it's like having a piece of the patient's medical history right there on the form,
Right,
which can be especially helpful if they're unable to communicate effectively.
exactly. And then we move on to cardiac monitoring.
Okay.
This section is used to document the patient's heart rhythm if they've been connected to an electrocardiogram or ECG.
Ah, yes. The ECG, it's like listening to the heart's electrical symphony.
A very poetic way to put it.
Right.
The ECG provides a visual representation of the heart's electrical activity,
Okay.
allowing paramedics to detect any irregularities in rhythm or conduction.
Yeah.
This can be vital in diagnosing and treating heart attacks, arrhythmias, and other cardiac conditions.
It's incredible how technology is being used in pre-hospital care to provide such sophisticated monitoring and diagnostics.
Absolutely.
Okay.
And as we approach the end of the section details, we encounter a section that emphasizes the collaborative nature of emergency care: consultations.
Consultation. So paramedics aren't just working in isolation.
Right.
They're reaching out to other medical professionals when needed.
That's right. This section is used to document any consultations the paramedics had with physicians or other healthcare specialists,
Okay.
either by phone or radio,
Mm-hmm.
regarding the patient's care.
That's really reassuring to know. It means there's a whole network of expertise available to support paramedics in making the best decisions for their patients.
It highlights the importance of teamwork and communication in emergency medicine. And finally, we arrive at the last section of section details:
Okay.
patient refusal.
Patient refusal. So this is for situations where a patient chooses to decline transport or further medical attention.
Precisely. And this is where meticulous documentation becomes even more critical.
Okay.
Paramedics need to clearly record the patient's capacity to make decisions, the risks and benefits that were discussed, and the patient's informed refusal of services.
Wow, that's a lot of responsibility. It's not just about providing care, it's also about respecting patient autonomy and ensuring everything is properly documented.
Absolutely. It's a delicate balance that paramedics navigate with professionalism and compassion.
Well, we've reached the end of our journey through the ambulance call report. And I've got to say, it's been an incredible learning experience.
I'm glad to hear that.
I had no idea how much detail and thought goes into these forms.
It's truly a testament to the dedication and expertise of paramedics. These reports may seem like simple paperwork, but they're actually powerful tools.
That capture the essence of emergency care from the initial call for help to the arrival at the hospital.
And what I find most remarkable is how the ACR goes beyond Just being a record of an individual patient's encounter, it becomes a valuable resource for understanding health trends, improving system efficiency, and ultimately saving lives.
Couldn't agree more. It's a treasure trove of data that can be analyzed and used to improve pre-hospital care and inform public health initiatives.
So as we wrap up this deep dive, I have to ask, what's one thing about the ACR that surprised you or that you think most people wouldn't realize?
You know, for me, it's the human element. It's easy to get lost in the codes and the technical details, but each ACR represents a real person going through a real crisis.
Yeah, that's very true.
It's a reminder that behind all the data points, there are human stories of courage, resilience, and the unwavering dedication of those who answer the call for help. So that's a beautiful way to put it. And for our listeners, I'll leave you with this. Think about the sheer volume of data points collected in each ACR. What kind of stories could this data tell about the health and needs of our communities? How can we use this information to create a more responsive and resilient healthcare system for everyone? Until next time, keep diving deep and keep asking questions.
All right, strap in everybody, because today we are going deep into the world of EMS.
Oh, yeah.
You know those forms that paramedics are always scribbling on after an ambulance call?
Mm-hmm.
Turns out they're a lot more than just patient records.
Right.
We're talking about the ambulance call report,
The ACR.
or ACR for short, and we've got some excerpts from the official completion manual to help guide us along the way.
Awesome.
So, joining me today for this deep dive is a true expert in emergency medical services.
Excited to be here.
I'm really excited to pick your brain about this because this is a fascinating topic to me.
Yeah.
So, you know, when most people think of an ambulance call report, they probably just picture
Yeah.
like a bunch of medical jargon and maybe some squiggly signatures.
Yeah, absolutely.
But it turns out these reports are like a gold mine of information.
They are.
Right.
They are really a Swiss Army knife of information.
Ooh, I like that.
It's crucial for hospitals, obviously.
Obviously.
But then it feeds into administrative statistics, research, even legal cases.
Wait, hold on. Legal cases.
Yeah.
So these forms can actually end up in court.
Absolutely, yeah.
Okay, so multiple uses. But how? Give me an example.
So imagine a researcher
Okay.
is studying the effectiveness of a new pre-hospital stroke treatment.
Hmm.
The ACR lets them compare patient outcomes.
Okay.
Right there in the results section, those who received the new treatment versus those who didn't.
Wow.
That's powerful stuff.
So it's like real-time data shaping how we approach emergency care.
Precisely.
That's incredible.
And it's not just about one patient, it's about spotting trends across thousands of calls.
Right.
Analyzing ACR data actually helped pinpoint a neighborhood with a high rate of falls among seniors,
Oh, wow.
which then led to targeted community outreach.
That's incredible.
Yeah.
I never realized those forms had such a wide impact.
Oh, they do.
That's amazing.
Yeah, and the manual gets super specific about the terminology, too.
Oh, does it?
Yeah, did you know there's actually a difference between a patient and a call?
Wait, so a call doesn't always mean there's a patient.
Exactly.
That's surprising.
Yeah, so let's say you call an ambulance because your grandma has fallen,
Okay.
but by the time the paramedics arrive, she's feeling better and refuses assessment. That's still logged as a call, but she wouldn't be classified as a patient in the ACR.
Okay, so they're really specific about that.
Very specific.
So they need to be really precise to avoid any confusion down the line.
Exactly. Every detail matters, especially when it comes to legal situations or research studies.
Right, because if you have a term that can have multiple meanings, then it just muddies the waters.
Exactly.
And especially if you are talking about, you know, research that's spanning years
Absolutely.
and you're pulling data from all these different reports, you've got to make sure that everyone's speaking the same language.
Everyone's on the same page. Yep.
Speaking of details, the manual also talked about paper ACRs versus electronic ones. Are they both equally detailed?
Absolutely.
Okay.
Whether a team is using pen and paper or a fancy tablet.
Right? The information collected is identical.
Okay.
Consistency is key for accurate data analysis.
But I can imagine switching to digital record keeping in such a fast-paced environment
Yeah.
must come with its own set of challenges.
Oh, definitely. There's ensuring devices are charged and functioning,
Right.
dealing with potential tech glitches in the field, training paramedics on new software.
Cascading, yeah.
It's a huge undertaking, but the benefits are enormous.
Yeah.
Like faster information sharing and fewer errors,
Mhm.
all leading to better patient care.
Right. So it's a classic case of balancing progress with practicality.
Absolutely.
But let's get into the nitty-gritty of the report itself.
Okay.
The manual lays it out in a very organized way, almost like a blueprint.
It is, yeah.
And this standardization, I mean, this isn't unique to ACRs.
No.
I mean, think about those forms you fill out at the doctor's office.
I see, that's
Every
right.
question and checkbox has a reason.
It's all about collecting the most relevant information
Hmm.
clearly and consistently. So when it comes to the ACR, we're talking pages, specific sections, individual fields.
It's very deliberate.
So let's dive into some of these fields.
Okay.
I'm especially curious about the results section.
Yeah.
It's not like they're grading the paramedics
Well,
on how well they done.
Right. No, not quite.
Okay, good.
The results section is where paramedics document the outcome of the call.
Okay.
Was the patient transported? Did they refuse care? Were they treated on scene and released?
Gotcha.
These seemingly simple data points help us analyze the types of calls paramedics respond to
Okay.
and how effective different interventions are.
So we can track if certain treatments are working in the field
Yep.
and if certain areas need different resources.
You got it.
And then you have fields related to patient demographics, age, gender, location.
Hmm.
This might seem basic, but I imagine it's crucial for understanding healthcare needs across different populations.
It is. It helps identify potential health disparities.
Right.
Like if certain groups are calling for ambulances more often for specific issues.
Yeah, I see what you mean.
And that can lead to better allocation of resources and public health initiatives targeted toward those communities.
Wow. The more we dig into this,
Yeah,
the more I realize those reports are packed with information.
they really are.
It's incredible.
But it doesn't stop there.
What? There's more.
Yeah.
Oh, boy. All right.
This information doesn't just vanish once the ambulance reaches the hospital.
Hold on.
Yeah.
You're telling me it goes even further than that.
You bet.
All right. Spill the beans.
That ACR information is shared with the hospital,
Okay.
becoming part of the patient's medical history.
So it's like a crucial link in the chain of a patient's treatment,
Yes,
connecting the dots from the ambulance to the hospital.
precisely. It's a powerful reminder that emergency medical services is an integral part of a much larger healthcare ecosystem.
Okay, so we've established that it's more than just a form.
Much more.
It's like this thread that connects everything.
It is.
But where does that thread lead? What happens to this information after it's handed off to the hospital?
That's where things get really fascinating. It's not just about filing away these reports.
yeah.
The data is analyzed to uncover trends and identify areas for improvement.
Okay.
It's like putting together a giant puzzle,
Oh, okay.
with each report a tiny piece.
Uh-huh.
And the result is a clearer picture of our healthcare landscape.
So it's about seeing the patterns and connections that might not be obvious just by looking at individual cases.
Exactly.
Okay.
For example, by analyzing ACR data from a specific region, we might see a sudden increase in calls related to heat stroke during a heat wave
Yeah.
that could trigger public awareness campaigns,
Oh.
encourage preventative measures,
Mhm.
or even help allocate resources like cooling centers more effectively.
That's a great example.
Yeah,
It shows how this data can shift from reacting to emergencies
right.
to proactively addressing them before they even happen.
You're spot on.
That's really cool.
And with advancements in technology and data analysis, the potential for using ACR data to improve pre-hospital care is immense.
Really?
We can start to predict call volumes based on weather patterns or even major events,
Oh, wow.
leading to better preparedness and faster response times.
So instead of just reacting to calls as they come in,
Right?
we can anticipate them and have resources ready to go.
Absolutely.
That's a game changer.
It's like using data to create a more responsive and intelligent emergency medical system.
I'm starting to see how powerful this all is.
Yeah.
But I do have one question.
Okay.
Earlier, you mentioned how specific these reports are,
Mm-hmm.
even distinguishing between a call and a patient.
Yeah.
Does that level of detail ever create challenges for paramedics, especially in high-pressure situations?
That's a great question.
Yeah.
And you're right, it can be a balancing act.
Right.
Paramedics need to gather crucial information quickly and efficiently,
Right.
all while providing critical care.
Of course.
The design of the ACR, though,
Aims to streamline this process,
Yeah.
using clear checkboxes and standardized fields to minimize the burden of documentation.
so it's designed to be user-friendly even in a hectic environment.
Exactly.
Okay.
And with electronic ACRs becoming more common,
Right?
a lot of the information can be automatically populated, like timestamps and GPS locations,
Yes.
freeing up paramedics to focus on patient care.
That makes sense.
Yeah,
It's about leveraging technology to make the process smoother for everyone involved.
precisely.
And as technology continues to advance, we can expect even more streamlined and efficient ways to gather and analyze this valuable data.
Absolutely.
I'm really curious to see how the ACR evolves in the future.
Yeah.
It sounds like we're just scratching the surface of what's possible with data-driven insights.
Absolutely. We're only beginning to tap into the potential of big data in emergency medical services.
Wow.
Imagine a future where we can predict and prevent emergencies before they even occur.
Now, that's a thought-provoking idea.
It seems like the ambulance call report, something most people probably never think twice about,
Yeah.
is actually at the forefront of a revolution in how we approach healthcare.
It really is. And as we wrap up this part of our deep dive,
Okay.
it's important to remember that this isn't just about abstract data points.
Right.
It's about using information to improve real lives and create a more responsive and effective healthcare system for everyone.
It all comes back to the patients.
Exactly.
And we are back for the final part of our deep dive into the ambulance call report,
The ACR.
the ACR.
It's been quite a journey, hasn't it?
It has. It's amazing how much ground we've covered, from those little check boxes
Right.
to the potential for revolutionizing emergency care with data.
It really shows you how something so seemingly simple
Yeah.
can have such far-reaching implications.
You're right. It's a great reminder that even the smallest details can contribute to a much larger understanding. You know, it's like that saying, for want of a nail, the shoe was lost. For want of a shoe, the horse was lost. And for want of a horse, the rider was lost.
Ah, that's a great analogy.
I thought so.
And it perfectly illustrates how crucial, accurate, and detailed information is, especially in emergency situations.
Exactly. But with all this talk about data collection and analysis, I can't help but wonder about the human element. What about the patients?
Right.
What are their rights when it comes to this kind of information?
That's a very important consideration.
Yeah.
We've talked about the ACR being shared with hospitals for continuity of care,
Right.
but it's crucial to remember that patient privacy is paramount.
Right. Yeah.
There are strict protocols in place to ensure confidentiality
Right.
and responsible use of this data.
So it's not like this information is just floating around freely.
Not at all.
Okay.
Access to this data is strictly controlled and limited to authorized personnel.
Makes sense.
And patients always have the right to request access to their own records and understand how their information is being used.
That's reassuring to know.
Yeah.
It sounds like there's a real effort to balance the benefits of data-driven insights with respecting individual privacy.
Absolutely. It's a delicate balance.
Yeah.
But one that the healthcare system takes very seriously.
Good.
And as technology continues to advance,
Uh-huh.
we can expect even more robust safeguards to protect patient information.
That makes sense. So for our listeners who are now thoroughly fascinated by the world of emergency medical services data,
Right.
what's the key takeaway here? Why should they care about the intricacies of the ambulance call report?
I think it's a powerful reminder that we're all part of a larger system, whether you're a patient,
Right.
a healthcare provider,
Yeah.
or someone who might need to call 911 someday.
Right.
Understanding how data is collected and used can empower us to advocate for better care
Okay.
and make informed decisions about our own health.
That's a great point. It's not just about abstract numbers. It's about real people's lives and well-being.
Exactly.
This has been an incredible journey.
It has.
We started with a simple form and ended up exploring the future of emergency medicine.
We did.
All thanks to the unassuming but mighty ambulance call report.
It just goes to show that there's always more to learn, even about things we might take for granted.
So for all you listeners out there, the next time you see an ambulance beat by, remember the power of that little report they're carrying. It's not just paperwork.
It's not.
It's a lifeline of information,
It is.
a tool for improving care, and a glimpse into the future of emergency medicine.
Absolutely.
And if this deep dive has sparked your curiosity,
As I'm sure it has.
we encourage you to keep exploring. There's a wealth of information out there waiting to be discovered.
There is.
Until next time, keep asking questions and keep diving deep.
So long, everybody. Okay, so get ready for this. We're going deep into like the heart of emergency medicine. You know those ambulance call reports? The ACRs, the ones you see like a flash as paramedics rush by.
Right.
Well, it turns out those reports are way more than just paperwork. They're like clues, each one telling a whole story about, what happened and how things went down in those critical moments.
Yeah, it's fascinating how something that seems like routine documentation actually unlocks so much about how emergency medical services work.
Exactly. And today, we're diving headfirst into this world, guided by the Ambulance Call Report Completion Manual.
Right.
And trust me, this manual, not just some boring technical stuff. It reveals some surprising things about how these reports are used, not just for patient care, but for research and even, get this, legal cases.
Yeah, most people probably picture these reports just going into a patient's file, but their impact is way bigger than that.
Okay, so before we get lost in the details, let's make sure we're all on the same page. This manual uses some specific terms, so let's break them down a bit.
Sounds good.
Because clear communication is crucial, especially in a field as, fast-paced and critical as emergency medicine.
Absolutely, yeah, every second counts.
Exactly. So, for example, there's patient, which seems pretty obvious, right?
Right.
But the manual gets super specific about who actually qualifies. So imagine, like, a bystander gets hurt trying to help during an incident. They become a patient too.
Oh, interesting.
And that data is crucial for understanding the full impact of the event.
Makes sense. You need the whole picture.
Then there's EACR, the digital version of the report. Now, you might think it's just a paper form on a screen, right?
Right.
But it's way more powerful than that. EACRs are giving researchers the tools to, predict emergency hotspots, or track how effective different treatments are. It's potentially saving more lives.
Yeah, it's revolutionizing how we approach data in emergency medical services.
Yeah.
EACRs can help us understand not just what happened in one emergency, but what might happen in the future, what we need to prepare for.
That's pretty mind-blowing. And all this information, it's not just randomly thrown into the report, it's organized very carefully within the ACR. There's a real logic to it.
Right. The manual actually lays out these specific sections, like demographics and clinical treatment procedures. Each one is a piece of the puzzle.
This layout seems pretty complex. What's the logic behind it? And, why should I, someone who's not a paramedic, care about this?
Well, think of it like a detective piecing together a story. Right?
Yeah.
Each section of the report gives you a clue. So demographics tells us who the patient is, their age, their location, all that. Clinical treatment tells us what the paramedics did to help, the medications they gave, the procedures they performed. It's all documented meticulously.
So they really squeeze a ton of detail into these reports. And speaking of accurate records, there's something in the preface that kind of caught my eye. It mentions how these ACRs can actually end up in court.
Oh.
Yeah, it makes you realize these aren't just forms, they're official records. Tell me more about that. How important is accuracy in these reports, especially with the legal stuff?
Accuracy is paramount, especially when it comes to legal matters. Think about it. These reports could be evidence in an investigation or a court case, so every single detail really, really matters.
Yeah, like if a paramedic's actions are questioned.
Exactly. The ACR becomes a key piece of evidence in figuring out what happened if the right steps were taken.
Okay, this legal stuff is making me nervous, but how do they make sure everything is accurate? What's the process?
Well, the manual really stresses standardization and clarity. It outlines very specific rules for how information should be recorded to make sure it's consistent across all reports. It doesn't matter who's filling it out.
So it's like having a universal language for emergency medical services.
Exactly. Everyone's on the same page.
That makes a lot of sense. It's like, a recipe. If everyone follows the same steps, you get consistent results.
Right.
But what about ECRs? Do those help with accuracy?
Oh, absolutely. Electronic systems can improve accuracy in a few ways. They often have built-in checks like, drop-down menus with predefined options or alerts if something's missing. So that helps reduce typos or incomplete records, which could be a problem later on.
So it's like a safety net built right into the system.
Yeah, exactly.
But isn't there a risk of, becoming too reliant on data and losing that human touch in emergency care?
That's a really important point to consider. The goal is to enhance care with technology, not to replace the human element. EACRs should be tools for paramedics to do their job better, not substitutes for their expertise and judgment.
I see. It's about finding the right balance.
Exactly.
But let's get back to ECRs for a second. The manual mentions that these electronic reports still have to include all the same components as the paper ACR, even with all the new features they have. It's like they're really trying to keep things consistent, even with all the advancements.
Oh, absolutely. That consistency is crucial for research and data analysis. Imagine trying to compare data from paper and electronic reports that are structured differently or have different information. It'd be impossible.
It'd be chaos.
It would be.
You're right.
But keeping a standard format means the data stays comparable and meaningful no matter how it's collected.
Makes sense. So a lot of effort goes into making sure the transition to EACRs doesn't, mess up the data they're trying to collect.
It really does. It shows the commitment of everyone in emergency medical services to constantly improve the care they provide.
That's great.
And it goes beyond just data collection. The manual also talks about having equivalent prompts and codes, and all the reference info available for paramedics using ECRs
Yeah.
has to be the same.
So it's not enough to just have the technology. You also have to provide the right support and tools to use it effectively.
That's a great way to put it. The goal is to make technology enhance patient care, and that takes planning and careful implementation every step of the way.
This has been super insightful. I'm already seeing these documents in a whole new light. It's like they're a secret code to how emergency medical services work.
I'm glad to hear that. It's always fun to discover the hidden complexities of things we take for granted, right?
It is, and I'm really struck by the focus on clear, standardized documentation. It's clear that these aren't just bureaucratic forms, they're essential tools for communication, analysis, and ultimately, improving how patients are cared for.
Absolutely.
And as we move into this digital age, it'll be interesting to see how EACRs keep evolving and shaping the future of emergency medicine.
Definitely.
Speaking of the future, our manual doesn't really get into the specific ways that the data in these reports is actually being used to improve emergency response. I'm curious about that. What are some real-world examples of how this data is making a difference?
That's a great question, and one that deserves more attention. We touched on research, but let's think practically. ACR data could help us identify patterns in emergency calls. Like maybe certain areas have way more heart attacks than others. And with that knowledge, you can strategically place resources where they're most needed. More ambulances, more personnel in those high-risk areas.
So it's like using data to create a heat map of emergency needs.
Exactly. It allows for a more targeted and proactive approach to emergency response.
That makes a lot of sense.
And that's just one example. ACR data can also help us track how well treatments are working. We can pinpoint areas where pre-hospital care could be better and even create predictive models, like what kinds of emergencies might happen in the future.
Wow, it's like turning data into actionable insights that can actually save lives.
Exactly. And as our tools for analyzing data get more sophisticated, we're only going to discover more innovative uses for ACR data.
This is all so fascinating. It really feels like we're on the verge of something big here. But are there any downsides to relying more and more on data?
That's a crucial question to consider. While data can be an incredibly powerful tool for improving healthcare, we need to be careful about potential pitfalls. Like, if we rely too much on data, it could lead to a less personal approach to care. Where algorithms and stats overshadow clinical judgment and the human connection.
Right. It's important to remember that healthcare is about people, not just numbers.
Absolutely. We need to make sure data is used to enhance care, not replace the human element. And we need to ensure that all patients get equitable and high-quality care, regardless of the data.
So it's about striking a balance. Embracing the power of data while preserving compassion, empathy, and that personalized care that every patient deserves.
Perfectly said. It's crazy how much info they pack into each ACR. It's like a mini ER on wheels, capturing every little detail of the emergency response.
Seriously, reading this manual, I realized I had no clue what actually goes on in an ambulance. Like all these procedures and protocols I never even thought about.
And with ECRs, things get even more interesting, because they can connect with other systems, like GPS, hospital records, all that.
Yeah.
It gives us a level of insight we could only dream of with those old paper forms.
So it's not just documenting what happened in the ambulance, it's connecting everything, the whole healthcare system.
Precisely. Imagine like an ambulance gets sent to a car accident, right?
Okay.
With EACRs, the system can instantly check traffic, find the closest trauma center, even alert the hospital about the patient's condition, all while the paramedics are still on their way.
That's insane. It's like this perfectly coordinated system, all thanks to data.
It is, and the benefits go way beyond just efficiency. EACRs can improve the quality of care, too, by giving paramedics feedback in real time.
Oh, interesting.
Think about it. A system that analyzes the patient's vital signs, then suggests the best treatment based on the latest research.
Whoa, it's like having a medical expert riding shotgun.
It really is pushing the limits of what we can do in those crucial moments before the patient gets to the hospital. But of course, with any new tech, there are challenges. One of the big ones is data security.
Right, keeping that info private.
Exactly. Imagine if all those sensitive patient details fell into the wrong hands.
Yeah, that's a scary thought, like giving your entire medical history to a stranger.
It's a big deal. That's why we need strong security measures in place. Encryption, access controls, regular checks, the whole 9 yards.
So it's like this high-stakes game of cybersecurity, but with people's well-being on the line.
You got it. And it's not just about protecting data from outsiders. We also need to prevent mistakes or misuse within the healthcare system itself.
So building a culture of responsibility around that data.
Absolutely. Everyone who touches ECR data, from paramedics to hospital staff to researchers, they all need training on how to handle it properly and ethically.
It's a lot of responsibility, but it's also a huge opportunity to use data for good. Speaking of opportunities, I'm really curious about the research potential of ECRs. The manual touches on it, but can you expand on how this data is helping us understand emergency medicine better?
It's a field that's just exploding with possibilities. Like, researchers are using ECR data to study how effective different treatments are for things like cardiac arrest.
Wow.
They're identifying risk factors for injuries, even developing early warning systems for disease outbreaks.
That's amazing. It's like these reports are a goldmine of medical knowledge.
They are. And the more data we gather, the more powerful those analyses become.
Yeah.
Imagine being able to predict which patients are most likely to have complications.
Oh, wow.
That means we can intervene earlier, be more targeted, potentially save more lives.
That's incredible. It's like using big data to personalize emergency care, but I imagine analyzing that much information comes with its own set of challenges.
Oh, definitely. One of the biggest hurdles is making sure the data is standardized. Different ambulance services might use different systems or ways of coding things, so it's hard to compare data across different regions or hospitals.
So it's like trying to solve a puzzle with pieces that don't quite fit.
Exactly. That's why there's this push for everyone to use the same data dictionaries and reporting methods, so it's all consistent and we can do large-scale research.
It sounds like a huge project, but the payoff could be enormous.
It really could. And it's not just about research either. Standardized data can help us compare how well different ambulance services are doing. Response times, treatments, patient outcomes, all that.
So it encourages everyone to constantly improve and be more innovative.
Exactly. And that's what's so cool about EACRs. They're not just about recording what happened in the past, they're about shaping the future of emergency care.
That's a great point. This deep dive has really opened my eyes to the potential of EACRs. It's like we're witnessing this revolution in data-driven healthcare happening right now.
It's an exciting time to be involved, that's for sure. And who knows what the future holds as technology keeps advancing.
Speaking of the future, our manual mentions some of the challenges of actually switching to EACRs. What are some of the roadblocks ambulance services might hit along the way?
Well, one of the biggest ones is cost. Putting in these new systems can be expensive, especially for smaller services that don't have a ton of money.
Yeah, I can imagine. It's like overhauling your entire tech infrastructure overnight.
Right. And then there's training everyone to use the new systems. Some paramedics might be resistant to change, especially those who are really used to the paper forms.
It's like anything new, there's going to be an adjustment period.
Exactly. But a lot of paramedics are actually excited about ECRs. They see them as valuable tools that can help them do their jobs better.
So it's about making that transition smooth, making sure everyone has the support they need to adapt.
Exactly. And we can't forget about the possibility of technical glitches. What if a system crashes in the middle of an emergency?
Oh man, that's a nightmare scenario.
It is. That's why backup systems are so important. And regular maintenance, too, to make sure everything is running smoothly and securely.
Sounds like a lot of work, but I guess the benefits outweigh the challenges in the long run.
I think so, too. At the end of the day, the goal is to use technology to help people get better care. And ECRs are a big step in that direction.
I agree. This deep dive has really changed how I think about ECRs. They're not just tools, they're changing the game in emergency medicine.
They really are. And this is just the beginning. Who knows what incredible applications we'll discover as technology keeps developing.
It's exciting to think about. But before we get carried away with the future, let's focus on something the manual mentions. Equivalent prompts for EACRs. What does that even mean?
Basically, it's about making the switch from paper to digital as smooth as possible. Equivalent prompts are like the digital versions of the questions you'd see on a paper ACR.
So it's like translating the language of the forms into something the computer understands.
You got it. That way, paramedics, using ECRs, are still capturing the same crucial info, even if the format looks different.
It's like making sure everyone's speaking the same language, whether they're using a typewriter or a computer.
That's a perfect way to put it.
Yeah.
And it's not just about the questions themselves. The manual also talks about providing the same codes and reference info that paramedics are used to having in their paper manuals.
Yeah.
But now it needs to be easily accessible on the computer.
So basically, you're trying to create a digital environment that's just as good as the paper system, if not better.
Exactly. We want to make the transition easy, so paramedics can focus on what matters, taking care of their patients.
It sounds like they've put a lot of thought into making EACRs actually work in real-life situations.
They really have. It shows how dedicated everyone in EMS is to providing excellent care, even as they're adopting all this new technology.
I agree. Well, I think we've covered a ton of ground on ECRs. We've talked about the good stuff, the tough stuff, and all the careful planning that goes into making these systems work well.
It's been a fascinating conversation, for sure. And it really highlights how data has the potential to change healthcare as we know it.
Absolutely. But something's been on my mind throughout this whole deep dive. We've talked tech and data, but what about the ethical side of things?
Oh, yeah, good point.
EACRs can clearly improve emergency care, but I can't help but think about privacy. Like, is all this data collection putting patient confidentiality at risk?
That's a huge question and a really important one. As we gather more and more patient data, we have to be super careful about protecting people's rights and making sure that info is used responsibly and ethically.
It's a tricky balance, isn't it? We want to use data to make healthcare better, but not if it means compromising someone's privacy.
I hear you. It's a conversation we need to be having, and it needs to involve everyone: doctors, policymakers, researchers, and most importantly, the patients themselves.
So it's not just about the tech itself, it's about the ethical rules we build around it.
Exactly. We need to make sure data is used to help people, not exploit them.
I'm glad we're talking about this because it's something everyone needs to be thinking about as healthcare relies more and more on data.
I agree. As we move forward with ECRs, we can't lose sight of the fact that the ultimate goal is to help patients. And that means doing it in a way that's ethical, fair, and benefits everyone.
We've talked a lot about the tech behind these ECRs, but I'm kind of curious about the human side of things. Like, what do the paramedics think about all this, going from paper to digital?
Yeah, that's a great point. It's important to remember these paramedics are the ones actually using this stuff, out there in the field, dealing with real emergencies. So their perspective really matters.
I bet there's like a learning curve, right? Going from scribbling notes on a bumpy ride to like trying to tap on a screen.
Oh, definitely. There's always an adjustment period. And some paramedics might be a little hesitant at first, especially those who are really used to that old paper system. But a lot of paramedics are actually embracing the ECRs. They see how much they can help with patient care.
So what do they like about them? What are the pros?
Well, for one, ECRs streamline all that documentation. Less time on paperwork, which means more time for the patient.
Makes sense.
Imagine being able to put all that info in super fast and accurately, even in a moving ambulance.
Yeah, that's huge when you're dealing with a time-sensitive situation.
Absolutely. EACRs also improve communication between paramedics and the hospital.
Oh, how so?
They can send all the vital patient info electronically, so the hospital is ready the second the ambulance gets there.
Wow, that could really make a difference in those critical cases where every second counts.
Exactly. And EACRs can actually help paramedics make decisions in the field.
Okay, how?
Like, imagine having instant access to drug databases,
Mm-hmm.
clinical guidelines, even expert consultations, all right there on the screen.
That's like having a whole medical team riding along with them.
Pretty much. It helps paramedics make better decisions and ultimately provide the best care.
That all sounds amazing, but I'm sure there are some downsides too. What do paramedics find frustrating about EACRs?
Well, one thing is that some systems can be clunky and hard to use, especially in those high-stress moments. Trying to work a tiny touchscreen in a bumpy ambulance isn't exactly easy.
No, not at all.
Another concern is that EACRs can feel kind of impersonal. Like you get so focused on putting the data in that you might miss those subtle cues from the patient.
It's a good reminder that technology should never replace that human touch in healthcare.
Definitely. It's about finding that balance between using technology and remembering the art of medicine.
This has been so insightful. It's great to hear about those real-world experiences of the paramedics. But let's talk about the data analysis side of things. What happens to all that data that's collected through the EACRs? Who looks at it? What do they do with it?
That's where the data scientists and analysts come in. They take all that info and try to find the patterns, the trends, the things that might not be obvious at first glance.
So it's like they're mining for gold, except it's knowledge instead of precious metals.
Exactly. They're sifting through mountains of information, trying to find those valuable insights. Like maybe they discover that certain neighborhoods have more heart attacks or that response times are slower in particular areas.
That's really useful info.
Right. Ambulance services can use that to figure out where to send resources or where they need to focus their prevention efforts. It could actually save lives.
Absolutely.
And that's really just the tip of the iceberg. We can use data analysis to see how effective treatments are or figure out what leads to better outcomes for patients. We can even start to predict what kind of healthcare needs we'll see in the future.
Wow, that's like having a crystal ball for emergency medicine.
Pretty much. We're moving from just reacting to emergencies to actually being proactive and prepared.
That's incredible. But I'm guessing analyzing all that data comes with its own set of challenges.
Oh yeah, for sure. One of the biggest ones is making sure the data is high quality and consistent. Like we talked about before, different ambulance services might have different systems or ways of doing things. It's hard to compare apples and oranges.
It's like trying to build a house using bricks that are all different sizes and shapes.
Exactly. That's why it's so important to have everyone using the same standards for collecting and reporting data.
So it's a huge project, but definitely worthwhile.
Absolutely. And then there's the technology side of things. We need to develop the tools and techniques that can handle all this data. It's complex and there's a lot of it.
It's like we're building a better microscope so we can see into the world of emergency medical services.
Love that analogy.
Mm.
And as those tools get better and better, we're going to learn even more and make even more progress in emergency care.
I'm starting to see EACRs less as data collection tools and more as like a launch pad for a whole new era of data-driven healthcare.
It really is an exciting time to be part of this field. I'm eager to see what the future holds. And as we wrap up this deep dive, I want to leave our listeners with one final thought.
Please do.
As we get more and more into this world of data, we need to remember the human element of it all. Every piece of data represents a real person with a story, a family, a life that's been touched by emergency medical services.
That's an important thing to remember. It's easy to get lost in the tech and the numbers, but it's really about people.
Absolutely. We can't let the pursuit of data-driven progress make us forget about compassion, empathy, and doing what's best for every individual patient.
Couldn't have said it better myself. Well, this deep dive has been fantastic. We've learned so much about ambulance call reports, from the paper forms to the new EACR systems and their impact on emergency medicine.
It's been a pleasure sharing this journey with you and our listeners.
We hope you've enjoyed the deep dive. Until next time, keep exploring, keep asking questions, and keep diving deeper into the world around you. All right, strap in, everyone, because today we are going deep, deep into the world of emergency medicine.
Yeah, you could say that.
We're cracking the code, the secret language of paramedics, all those cryptic notes and numbers, all over an ambulance call report, an ACR.
Exactly.
By the end of this deep dive, you'll be able to listen in on an ambulance run
Right.
and know exactly what's going on as if you were right there with the crew.
Like you're shadowing them for the day.
Picture this. Sirens blaring, ambulance screeches to a halt, paramedics jump out, they're assessing the patient, gathering information, taking vitals,
And fast.
all under pressure. They're working quickly and efficiently.
Working quickly is right.
It's pretty intense, but they've got this ACR. It's their main tool for documenting everything, right?
It is, yeah. The ACR keeps everyone on the same page.
Okay.
It makes sure that in these really high-stress situations,
Yeah,
that we've got a standardized approach, Clear communication.
I see.
Like, let's say you've got a patient who's not really with it mentally. Something as small as how their pupils react to light. That can be a huge clue for diagnosis and treatment.
So it's not just about writing down numbers. It's really about capturing those little details
Right.
that can change the whole course of treatment.
You got it.
All right, so let's break down this ACR bit by bit.
Okay.
I'm looking at our sources here.
Yep.
It looks like a whole bunch of data points get recorded. Where do we even start?
Well, there's this reading code section.
Oh, yeah, that one.
Seems kind of mysterious. right?
Yeah, a little bit.
But actually, it shows how adaptable the ACR is
Oh, yeah.
to, the constantly changing world of medicine.
So what kind of stuff goes in there?
Oh, all sorts of things. Blood glucose levels, that's common.
Yeah.
But also readings from, cutting-edge diagnostic tools.
Okay.
Stuff that hasn't even been invented yet, probably.
Wow, so it's like future-proofed.
Precisely.
That's really cool. All right, let's
Let's move on to something a little more down to earth.
Yeah.
SpO2 and EdCO2.
Oh, yeah, those ones jumped out at me too.
We all know about oxygen and carbon dioxide,
Mm-hmm.
right? I mean, everyone's held their breath at some point
Oh, for sure.
and felt that need to breathe again.
Yeah.
But how do paramedics actually use these readings out in the field?
Yeah, that's what I was wondering.
Okay, so SpO2, think of it like it measures the percentage of hemoglobin in your blood that's carrying oxygen.
Mm-hmm.
If you held your breath, your SpO2, it would start to drop
Right.
because your body's using up all that oxygen. Paramedics, they use this to see how well a patient is oxygenating.
So a low SpO2, that's a bad sign, right?
Exactly. Could mean they're not getting enough oxygen.
Gotcha.
Then there's ETCO2. This measures the amount of carbon dioxide
Okay.
at the end of each breath.
Uh-huh.
Super important. Tells us if a patient is breathing effectively
I see.
or if their lungs are working properly.
So, like, if their ETCO2 is too high, that means they're having trouble breathing out that carbon dioxide.
Precisely. And that could be a sign of some kind of respiratory problem.
Wow. So these two, SpO2 and ETCO2, just like that, you get a snapshot
Right.
of the patient's breathing
That's a powerful tool.
and helps them decide on treatment,
It does.
especially if someone's struggling to breathe.
Yeah. Or if there's a potential airway obstruction.
It's amazing, how such simple measurements can tell you so much.
They can.
Speaking of information, the next data point on the list,
Okay.
it's the GCS, the Glasgow Coma Scale.
Mm-hmm.
This one, I'll be honest, it always sounds kind of intimidating to me.
Yeah, I get that.
Like straight out of a medical textbook.
It might sound complex, but it's actually really practical.
Okay.
It helps paramedics quickly figure out a patient's level of consciousness.
So, like, imagine you arrive at an accident scene.
Right.
You got to know right away, how alert is this person?
Exactly. And the GCS, it helps you do that.
Okay, walk me through it. How's it work in practice? What are the paramedics looking at?
Okay, so they're looking at three main things. Eye-opening, verbal response,
Uh-huh.
and motor response.
Okay.
Each area gets a score, and then you add it all up.
Okay.
And that gives you the overall picture of how conscious the patient is.
So, high score, good. Low score, not so good.
Exactly. So let's say a patient opens their eyes on their own.
Mm-hmm.
They're oriented, they're talking, they can follow commands. That's a high score.
Mm-hmm.
Means they're neurologically intact, all good.
Great.
But if someone's not opening their eyes,
Oh.
no sounds, not moving, that score is going to be way lower.
Yeah,
Means
okay.
there's a serious problem with their consciousness.
So, the GCS helps the paramedics decide, okay, what needs to happen first?
Absolutely. It can even predict how a patient might recover,
Wow.
and it guides all the treatment decisions.
Okay.
Like, if a patient has a low GCS, they might need immediate help with their airway,
I agree.
or we need to stabilize their vitals.
So this GCS, it's almost like a roadmap
It is, yeah.
for those first critical moments of patient care.
Face.
Really interesting stuff. All right, moving on. We've got another part of the neurological exam, pupil assessment. You know what they say? The eyes are the windows to the soul.
That's right.
But I'm guessing paramedics are looking for a little bit more than that.
Right, exactly. What's the big deal with the pupils?
It's not just about are they dilated or constricted.
Okay.
Paramedics are like detectives, you see. They're looking at the size of the pupils
Mhm.
and how they react to light.
Okay, I'm intrigued. What kind of clues are we talking about here?
Yes, the pupils can tell you a lot about what's going on inside the brain.
Oh, wow.
Like, if the pupils are fixed and dilated,
Okay.
that means they're not constricting when you shine a light in them.
Hmm.
That could be a big red flag.
Oh,
Could mean there's increased pressure in the brain.
that's serious.
It is. And it can help paramedics recognize these life-threatening conditions
Okay.
and make sure they do the right things to help.
So again, like tiny detail,
Right.
huge implications.
Yeah. It's amazing what you can learn from someone's pupils.
It is.
All right, let's move on to another key part of patient assessment.
Right.
Pain. How do you even measure that? It's so subjective.
You're right. It is subjective. It's not like taking their blood pressure
Yeah.
or checking their pulse, but it's still a vital sign.
So how do they assess it? How do they make sense of something that's so personal?
They usually use a pain scale.
Okay.
Ask the patient to rate their pain from 0 to 10.
Okay.
0 being no pain,
Yeah.
10 being the worst pain imaginable.
Got it.
It's not perfect,
I can imagine.
but it's a starting point.
Yeah.
For communication.
Yeah.
It helps paramedics understand how bad the pain really is.
But I bet there are some challenges, especially in an emergency.
You're absolutely right. Some people have a really hard time describing your pain,
Yeah.
like little kids
Yeah.
or patients who have cognitive impairments,
Right.
And of course, language barriers can be tricky too.
So what do they do in those situations?
We rely on our training and experience to look for other clues. We're looking at their face, their body language.
Yeah.
What kind of sounds are they making?
I see.
We also have special pain scales for kids or people who have trouble communicating.
Wow. So much goes into something that seems on the surface so simple.
It does. It really highlights the skill of these paramedics.
Right.
They're dedicated to providing the best care possible.
Okay, shifting gears a bit, there's a section on the ACR that caught my eye. Crew Embray No. Seems pretty basic administrative stuff. Why is it so important to track which paramedic did what?
That's a great question. It does seem like a small detail, but it's all about accountability,
Uh-huh.
quality control, and even legal reasons sometimes.
I don't think about that side of things much.
Yeah, so by documenting who did each procedure,
Okay.
we're creating a clear record. So we know every step was done properly.
Makes sense.
Helps ensure the care was top-notch, and if there are any questions later,
Yeah.
we can review everything.
Right.
We can track who gave what medications,
Mm-hmm.
who did what procedures.
Like a chain of custody for medical stuff.
Exactly. Keeps everything transparent and documented.
That makes a lot of sense. It's all about making sure patients are getting the best possible care.
Exactly.
All right, let's talk about another section that seems pretty important, the remarks section.
Okay.
What kind of stuff goes in there? Is it just for anything that doesn't fit in the other boxes?
You could say that.
Okay.
It's for all those details that don't have their own designated spot on the ACR,
Mm.
but they're still important to document.
Okay.
Helps paint a more complete picture of what happened.
So if something unusual happened during the call.
Exactly. Like, what if a bystander, someone with medical training, started helping before the ambulance got there?
Oh, yeah. Good point.
We need to know that. For
Right.
continuity of care,
Mhm.
or let's say the paramedics had trouble getting to the patient.
Okay.
Like maybe it was a hazardous environment or really rough terrain.
Gotcha.
That would go in remarks too.
So it's about adding that context.
Exactly.
That might not be obvious from just looking at the standard data points.
You got it.
It's like putting together a puzzle, right?
Yeah, it is.
Each section of the ACR is a piece of the puzzle,
Mm-hmm.
and together they give you this complete picture
Right.
of what happened and what's going on with the patient.
Exactly.
Wow, this is fascinating. We've only just scratched the surface of this ambulance call report.
There's a lot more to uncover.
I'm really looking forward to diving deeper after the break.
Me too.
So don't go anywhere. We'll be back in a flash.
We will.
We're back and ready to uncover more of the secrets hiding in this ambulance call report.
Absolutely. There's still plenty to explore.
Before the break, we were talking about those remarks and how they add valuable context.
Those extra details can be so important.
But let's move on to a section that seems to be about treating the patient with respect,
Right.
making sure their belongings are handled properly, disposition of effects.
Exactly.
What does that even mean in the context of, emergency care?
Well, it's about documenting what happens to a patient's valuables.
Okay.
Their wallet, purse, jewelry,
Mm-hmm.
medications, eyeglasses, dentures, things like that.
Oh, I see. So it's like making sure those things don't get lost in the shuffle.
Exactly. You can imagine how upsetting it would be to
Yeah.
get to the hospital and realize you don't have your dentures or your wedding ring.
Oh, absolutely.
It's not just about medical care.
Right.
It's about treating the patient with dignity and respect.
Yeah, that makes a lot of sense.
And from a practical side, the ACR keeps track of who has those belongings.
Right.
Make sure they get back to the patient safely.
Like a safeguard against those lost and found nightmares.
Exactly.
Okay, let's move on to a section that seems really important for figuring out what treatment the patient needs.
Okay.
Primary problem and problem code.
This is where paramedics really put their training and experience to work.
Mm-hmm.
They're looking at the symptoms and figuring out the underlying medical issue.
So it's like detective work.
You could say that?
Okay, so what's the difference between primary problem and just the patient's initial complaint?
Primary problem goes deeper.
Okay.
It's about figuring out the root cause of the emergency.
I see.
So someone might say they have chest pain, but the paramedic, after assessing them,
Yeah.
might determine that the primary problem is actually a heart attack.
So it's about connecting the dots, seeing the bigger picture.
Exactly. And then you have the problem code,
Okay.
which categorizes the medical issue using a standardized system.
So everyone's speaking the same language.
Precisely. It makes communication between healthcare providers so much smoother,
I see.
and it helps guide the treatment decisions.
Makes sense. But I imagine it's not always easy to pinpoint that primary problem.
You're right, there are definitely some tricky cases.
Yeah.
Sometimes the initial symptoms can be misleading, or
Yeah.
there might be multiple things going on at once.
Right.
That's where experience and critical thinking are so important.
Mm-hmm.
Paramedics are trained to consider all the possibilities, gather as much information as they can
Right.
to make the most accurate assessment.
It's a tough job, for sure.
It is, but they do it well.
Okay, let's talk about another section that seems crucial, especially when time is of the essence.
Right.
The S-Trans code, or Special Transport Code.
This is all about getting the right patient
Mm-hmm.
to the right place fast.
So certain conditions need specialized care, right?
Exactly. like someone having a heart attack,
Mm-hmm.
they need to go to a hospital equipped for cardiac catheterization.
Right.
Or a severe trauma case
Yeah.
needs to go to a trauma center.
Okay.
The SV trans code is like a signal,
I see.
tells the receiving hospital what to expect,
Mm-hmm.
make sure they're ready to provide the right level of care.
It's like a fast track for critical patients.
Exactly. No time wasted.
This is fascinating how each little piece of the ACR plays such a specific role.
It is, yeah.
It's like a roadmap for emergency care.
You could say that.
Makes everything more efficient, more accurate,
Mm.
and ultimately leads to better outcomes for the patients.
That's the goal.
Okay, we've covered a lot of ground, but there's still more to explore.
There is.
We'll be back after a short break to dive into the final sections of this ambulance call report. And we're back, continuing our exploration of this incredible document, the ambulance call report.
It really is packed with information, isn't it?
It is. It's amazing what you can learn from it. Before the break, we were talking about those special transport codes.
Right. Making sure patients get to the right facility.
Exactly. No time wasted. But let's switch gears for a sec
Right.
and talk about a section that seems a little more straightforward.
Right.
Signatures.
Yeah.
I mean, it seems pretty simple compared to some of the other stuff we've talked about.
It might seem simple, but it's actually really important.
Okay, how so?
Well, those signatures, they validate the information on the ACR.
Correct.
It's all about accountability,
Right.
making sure the record is accurate and complete.
Gotcha.
So the patient, or whoever's with them, they sign to say that the information is correct.
Yeah.
And the paramedic signs to confirm they did the assessment and provided the care that's documented.
So it's like the final seal of approval.
Exactly.
Make sure everything is official and reliable.
It's crucial for the integrity of the medical record.
All right, let's move on to a section that tells us what happened to the patient after the paramedics arrived. Patient disposition.
Right. This section documents the outcome of the ambulance call.
So what kinds of things are we talking about here?
Well, it could say that the patient was taken to the hospital,
Okay.
or that they refused transport,
Right.
or, in some cases, that the patient unfortunately passed away at the scene.
So it's like a snapshot of the immediate result of the call.
Exactly. It helps track patient care
Okay.
and understand how well the EMS system is working.
It's like the final chapter in the story of the ambulance call.
That's a great way to put it.
Wow, this has been an incredible journey.
It has.
We've gone deep into the world of the ambulance call report.
We have.
From those cryptic codes to those all-important signatures.
And everything in between.
It's amazing how much information is packed into this one document.
It really is.
Listeners, I hope you've enjoyed this deep dive as much as I have.
Me too.
Next time you see an ambulance, you'll have a whole new understanding of what's going on inside.
Yeah, you'll know that there's a team of highly skilled professionals in there.
Using their knowledge and compassion to take care of people.
And this ACR, it's their guide, their tool for making sure patients get the best possible care.
We've gotten a glimpse into their world and learned a little bit of their language, the language of saving lives.
It's been a pleasure sharing this with you.
The pleasure was all mine. Until next time, stay curious. Hey everyone, welcome back. Today we're going to be looking at, something that's pretty important to everyone, I think.
Oh, yeah?
Yeah. It's the Canadian Triage and Acuity Scale. CTS.
Okay, yeah.
So this is how paramedics in Canada decide
Right.
how urgent a patient is
Mm-hmm.
and who needs to be seen first.
Yeah.
So it's like a secret decoder ring for ambulance sirens.
Uh-huh. Okay. I like that analogy.
Well, we'll see if it holds up as we get into it.
Okay.
So when we talk about acuity,
Yeah.
what exactly do we mean in this like medical context?
So acuity in medicine basically means how sick someone is.
Okay.
But like more specifically, it's about how likely they are to die
Oh.
or to have some kind of like irreversible illness or injury.
So it's about the potential for things to go really wrong.
Yeah, exactly.
Okay.
And CTS helps paramedics figure that out quickly
Mhm.
and communicate it to everyone else involved.
Right, because in an emergency, clear communication is key.
Absolutely.
That
It's like
makes-
having a common language that everyone understands.
So everyone's on the same page right from the start.
Exactly.
Okay, so tell me about these CTS levels.
Okay, so there are 5 main levels,
Okay,
and they get assigned at different points during the whole emergency response process.
interesting.
So first you have CTS arrived patient.
Okay,
That's the initial assessment when the paramedics first get to the scene.
so before they've even started any treatment.
Right.
Okay, so that's like the first impression of how serious things are.
Yeah. And it also helps track how quickly paramedics are responding?
Right, because time is crucial in these situations.
Absolutely. Every second counts.
Okay, then what?
So then after they do what they can on scene,
Mm-hmm.
they reassess the patient
Mm-hmm.
and determine the CTS depart scene level.
Okay, so that reflects any changes in the patient's condition after they've received some initial care.
Exactly. It helps decide where the patient should be taken, like which hospital is best equipped to handle their situation.
Ah, so it's not just about getting them to the closest hospital, it's about getting them to the right hospital. And I'm guessing there's a final CTS level when they actually get to the hospital.
You get CTS arrived destination.
Makes sense.
It's like the final snapshot of the patient's condition when they arrive at the hospital.
So everyone's in the loop and ready to go.
Exactly.
Wow. It's like a medical drama unfolding in stages, each CTS level revealing more about the patient's story.
I like that.
But you mentioned earlier that there's one more level,
Oh, yeah.
CTS 0.
Yeah, this one's a bit different.
Okay, how so?
Well, this level applies to situations where resuscitation either isn't necessary
Okay.
or it's been stopped.
I imagine those are really tough situations to deal with.
They are definitely.
So when exactly would CTS 0 be used?
So, like, if the patient is clearly already deceased,
Oh, right.
or if they have a do not resuscitate order, a DNR,
Yeah, DNRs are important for respecting people's wishes about end-of-life care.
absolutely.
Hmm.
And CTS 0 can also apply if a doctor at the hospital has ordered to stop resuscitation efforts. Or if a doctor who happens to be at the scene, like if they just witnessed the event,
Mm-hmm.
and they're licensed by the College of Physicians and Surgeons of Ontario,
Okay.
they can pronounce the patient deceased, and then CTS 0 would apply.
So it's a pretty specific set of circumstances?
Yeah, it covers a range of those sensitive end-of-life situations.
Okay, so we've talked about these CTS levels and when they get assigned, but where is all this information actually recorded?
It all goes on something called the ambulance call report.
The ACR.
Yep, it's like a detailed log of everything that happens during an emergency response.
Sounds like a treasure trove of information.
It is. It has all the details about the ambulance itself,
Okay.
like the vehicle number, the station it's from,
Mm-hmm.
and then information about the hospital,
Okay.
like its Ministry of Health number, its official name.
So they really document every detail.
Yeah, it's about having a complete picture of the whole situation.
What else is on this report?
Well, they also use something called a UTM code to record the location.
A UTM code.
Yeah, it's a way to pinpoint the exact location of the emergency.
Wow, that's pretty high tech.
It helps make sure the closest ambulance gets dispatched.
Right, every second counts.
Exactly. But I think the most interesting part of the ACR is the section on dispatch priority codes.
Ooh, dispatch priority codes.
These codes determine how quickly the ambulance needs to get to the scene.
So that's how they decide if it's a lights and sirens situation or not.
Exactly.
Okay,
Yeah.
I'm all ears. Tell me more about these codes.
Well, each code represents a different level of urgency,
Okay.
and they range from non-emergency calls that can be delayed to those that require an immediate response.
So it's not just about rushing to every scene, it's about understanding the nuances of each situation.
Exactly. And we'll get into the specifics of these codes after a quick break.
Sounds like we're just scratching the surface of this whole emergency response system. I'm already hooked. All right, so those dispatch priority codes, let's break those down.
Okay, so,
I'm ready for some code cracking action.
All right, well, let's start with the most chill one. Code 1, deferrable call.
Deferrable, so like it can wait.
Yeah, it's like a non-emergency situation
Okay,
where a little delay won't hurt.
gotcha. So it's something like a minor cut or a sprained ankle.
Yeah, something like that.
Okay, what's next?
Code 2 is scheduled call.
Scheduled.
So it's still non-emergency,
Okay,
but it needs to
Yeah.
happen at a specific time.
okay. I see. So maybe someone needs to get to a dialysis appointment or something.
Yeah, exactly.
All right, and then we ramp up the urgency.
Yeah, so code 3 is prompt call.
Prompt call.
So this is where it starts to get a bit more serious.
Okay,
It's still an emergency,
right.
but a bit of a delay is okay.
Okay, so like maybe a broken bone
Yeah.
or a less severe allergic reaction.
Yeah, those are good examples.
Okay, makes sense. And then what about the real nail biters?
Code 4, urgent call.
Urgent call. Okay.
This is the one you see in the movies.
Lights and sirens, full speed ahead.
Exactly. We're talking about life-threatening situations.
Heart attacks, strokes, major trauma.
Yep, all those.
Wow, so that's the highest level of urgency.
It is.
Yeah.
And then we have a couple more that aren't directly related to a patient's condition.
Okay.
Code 8 is standby call.
Stand by.
Yeah. So this is when an ambulance is like waiting
Okay.
ready to respond to something that might happen.
Like a big event or a potential disaster.
Exactly.
Makes sense. And what about the last code?
Code 9 is out of service administration.
Out of service. So like the ambulance is unavailable?
Right. Maybe it's getting maintenance or something.
Okay, I see. So these codes, they really paint a picture of how the whole dispatch system works.
They do, and they help make sure that the right resources are available when they're needed.
Okay, so we talked about those 5 CTS levels before,
Mm-hmm.
but let's get into a bit more detail about what each level actually means.
Okay, sure.
Especially for anyone listening who might not be familiar with all the ins and outs.
All right, so starting with the most critical CTS level 1.
Level 1.
This is for patients who are in immediate danger of dying or having some kind of like irreversible damage.
So things like cardiac arrest,
Yeah,
major trauma, severe breathing problems.
exactly. These are the cases where every second counts.
And there's a target time for these level 1 calls, right?
Yeah, the ambulance needs to arrive at the scene within 8 minutes.
8 minutes. Wow.
90% of the time.
That's incredibly fast.
Yeah, those paramedics are under a lot of pressure.
I can imagine.
Okay.
Yeah.
So then we move on to CTS level 2.
Level 2. Okay.
These are still emergencies,
Mm-hmm.
but they're not quite as immediately life-threatening as level 1.
Okay.
So we might be talking about a stroke
Okay.
or a serious fracture.
So potentially life-threatening, but not like on the brink of death.
Yeah. And the target time for these level 2 calls is 15 minutes.
15 minutes. Okay.
90% of the time.
So still pretty quick, but with a little bit more breathing room.
Exactly.
And then what about level 3?
Level 3 is still an emergency, but it's generally less severe.
Okay.
So we might be talking about moderate pain,
Okay.
minor injuries, maybe a less serious allergic reaction.
So things that need attention but aren't expected to get worse really quickly.
Yeah, the target time for these calls is 30 minutes,
30 minutes?
90% of the time.
And then we get to the less urgent levels, right?
Right. So level 4 is for things like sprains,
Okay.
strains,
Yeah.
minor cuts that need stitches.
So still stuff that needs to be seen by a doctor, but not necessarily an immediate rush.
Exactly.
Hmm.
The target time for these is 60 minutes,
To 60 minutes, okay.
90% of the time.
And then lastly, level 5?
Level 5 is the least urgent.
Okay.
So we might be talking about stable chronic conditions,
Yeah.
minor ailments,
Mhm.
or even just requests for medical advice.
So things that might not even require going to the hospital.
Yeah, the target time for these is 120 minutes.
120 minutes, so 2 hours.
Yeah, 90% of the time.
Okay, so these levels, they really cover the whole spectrum of medical needs.
They do, and they help make sure that the ambulances are available for the most urgent cases.
Right, because if everyone with a sniffle called 911, the system would be overwhelmed.
Exactly.
But I'm curious, wouldn't it be more efficient for people with those less urgent issues to just go to a walk-in clinic or something?
Well, in a lot of cases, yeah, that would make more sense.
Okay.
But sometimes people might not be able to get to a clinic,
Right.
or their condition might be more serious because of other health problems they have.
So it's about making sure everyone has access to the care they need, regardless of their situation.
Yeah, that's the whole idea behind CTS.
It's a pretty impressive system.
It is. It's all about making sure that people get the right care
Mm-hmm.
at the right time.
And that resources are used wisely.
Absolutely.
Now, we've been focusing on how CTS works for ambulance dispatch,
Right.
but it's not just about ambulances, is it?
No, you're right. CTS is also used in hospital emergency rooms.
Oh, really?
Yeah, to help decide which patients need to be seen first.
So it's like triage within the hospital itself?
Exactly.
Wow.
It makes sure that the most critical cases get seen right away.
Okay, that makes sense. You wouldn't want someone with a heart attack waiting behind someone with a sprained ankle.
Exactly.
Wow, so this one system has a huge impact on the whole healthcare system.
It does. It's all about communication and coordination.
Now, while we've been talking about all the technical details of CTS,
Yeah.
I'm wondering, why should the average person care about this?
That's a good question. I think it's important for everyone to have a basic understanding of how emergency medical services work,
Mm-hmm.
especially the idea of triage.
Right, because most of us only think about it when we actually need it.
Yeah, exactly.
But knowing how it all works can help us make better decisions.
Absolutely. Like, if you're calling 911,
Mm-hmm.
being able to describe your symptoms clearly can help the dispatcher figure out the right CTS level.
So it's not just about knowing when to call 911.
Right.
It's about knowing how to call 911 effectively.
Exactly.
And even if you never have to call 911, understanding CTS can help you appreciate the work that paramedics and other first responders do.
Absolutely. It's a tough job.
Yeah.
And they deserve our respect.
Okay, so we talked about how those dispatch priority codes determine how quickly an ambulance gets to the scene.
Right.
But what happens when there just aren't enough ambulances to go around?
That's a great question, and it's a problem that a lot of places are facing right now.
Ambulance availability, it's a big issue, isn't it?
It is. There are a lot of factors that contribute to it.
Okay, so let's unpack that a bit more. What are some of those factors?
Well, one big one is that the demand for ambulances keeps going up.
So why is that?
Well, our population is aging,
Mm-hmm.
and there are more people with chronic health conditions.
So more people need medical attention overall.
Exactly.
And that puts a strain on the whole system.
Yeah, and it's not just the number of calls. It's also that those calls are getting more complex.
Oh, how so?
We're seeing more patients with multiple health problems,
Okay.
and that often means that they need more time and resources.
So it's not just about having enough ambulances.
Right.
It's about having enough paramedics with the right skills.
Exactly. And that brings us to another issue, staffing shortages.
Oh, right. I've heard about that. It's getting harder to find and keep qualified paramedics.
It is, especially in rural areas.
Yeah, it's a demanding job.
It is.
Long hours, stressful situations.
It's no wonder that a lot of paramedics experience burnout.
Right. Okay, so we've got increasing demand,
Mm.
more complex cases,
Mm.
and not enough paramedics.
That's a tough situation.
It sounds like it. And to make matters worse,
Yeah.
I've heard that ambulances sometimes get stuck at hospitals.
Oh, yeah. That's another big problem.
Wait, really? I thought they'd be rushing back out to answer more calls.
You would think so, but it happens a lot.
Why is that?
Well, it's often because the emergency rooms are overcrowded.
Ah, so there's no room for the patients coming in by ambulance.
Exactly. And that means the paramedics have to wait with their patients until a bed opens up.
Wow, and that can take a long time, can it?
It can, sometimes hours.
So the ambulance is out of commission for all that time.
Yeah, it's a real problem. It puts a lot of strain on the system.
It's like a domino effect. One problem leads to another.
Exactly. It all
Yep.
comes down to capacity.
Capacity.
Yeah, we need more resources across the whole healthcare system.
Okay, so more hospital beds, more long-term care facilities.
Exactly. We need to take some of the pressure off emergency medical services.
It sounds like a really complex issue.
It is. There's no easy fix.
So what are some of the things that are being done to address this?
Well, there are a lot of different approaches being tried,
Okay.
like increasing funding for paramedic training programs.
Okay, so trying to get more qualified paramedics out there.
Exactly. And then improving working conditions for paramedics.
So trying to prevent burnout and keep people in the profession.
Right. And also trying to find ways to reduce those offload delays at hospitals.
So getting those ambulances back on the road faster?
Yeah, it's a multi-pronged approach.
It sounds like there's a lot of work being done.
There is, and it's important work.
Absolutely. Well, this deep dive has been incredibly eye-opening. I never realized how complicated our emergency medical system is.
It is a complex system.
But it's also really fascinating.
It is, and it's something that affects all of us.
Yeah, because you never know when you might need to call 911.
Exactly.
Now, before we wrap things up, I want to leave our listeners with something to think about.
Okay.
Now that you know more about CTAS ambulance dispatch and all the challenges facing emergency medical services, how do you think we can all help make the system better?
That's a good question. I think it starts with understanding how the system works,
Right.
like we've been talking about today.
Exactly. The more we know, the better decisions we can make.
And we can also support initiatives that are trying to improve things for paramedics.
Okay, like advocating for better working conditions.
Yeah, and pushing for more funding for emergency medical services.
Those are all great ideas.
And remember, if you're ever in doubt about whether to call 911,
Yeah,
it's always better to err on the side of caution.
absolutely. Better safe than sorry.
Right.
Well, folks, that's all the time we have for today's deep dive into the world of Canadian emergency medical response.
It's been a pleasure.
It has been really interesting. And remember, even though our deep dive is over, your own exploration of this topic is just beginning.
That's right.
Keep asking questions, keep learning, and keep advocating for a better healthcare system for everyone.
Well said.
Until next time, stay curious. So what are some of the things that are being done to address this?
Well, there are a lot of different approaches being tried, like increasing funding for paramedic training programs, so trying to get more qualified paramedics out there.
Okay, and then improving working conditions for paramedics, so trying to prevent burnout and keep people in the profession.
Right. And also trying to find ways to reduce those offload delays at hospitals.
So getting those ambulances back on the road faster.
Yeah, the multi-pronged approach.
It sounds like there's a lot of work being done.
There is, and it's important work.
Absolutely. Well, this deep dive has been incredibly eye-opening. I never realized how complicated our emergency medical system is.
It is a complex system, but it's also really fascinating.
It is, and it's something that affects all of us because you never know when you might need to call 911.
Exactly.
Now, before we wrap things up, I want to leave our listeners with something to think about. Now that you know more about CTAS, ambulance dispatch, and all the challenges facing emergency medical services, how do you think we can all help make the system better?
That's a good question. I think it starts with understanding how the system works, like we've been talking about today. The more we know, the better decisions we can make.
Exactly.
And we can also support initiatives that are trying to improve things for paramedics, like advocating for better working conditions and pushing for more funding for emergency medical services.
Those are all great ideas. And remember, if you're ever in doubt about whether to call 911, it's always better to err on the side of caution.
Right. Better safe than sorry.
Well, folks, that's all the time we have for today's deep dive into the world of Canadian emergency medical response. It has been really interesting. And remember, even though our deep dive is over, your own exploration of this topic is just beginning. Keep asking questions, keep learning, and keep advocating for a better healthcare system for everyone. Until next time, stay curious. All right, strap in, everybody. We're going deep on a real ambulance call report today.
Oh, this is going to be good.
Focusing on, a cardiac arrest scenario.
Yeah.
Imagine like you're handed this dense medical report, right? After someone you love has been treated.
Oh, yeah.
And it's full of jargon, codes,
I can only imagine.
Where do you even begin?
Right.
That's where we come in. We're going to try and break down, at least a section of this report.
Yeah.
And really get into the weeds.
Cool.
Starting right from when those paramedics arrive on scene.
Okay.
So one thing that surprised me was how cardiac arrest is actually classified in these reports.
Oh, interesting.
It's not just about someone's heart stopping.
Right.
There's this whole system, based on like who witnessed it.
Oh, okay.
So is it a trained responder?
Hmm.
Another medical professional maybe?
Okay.
Police, firefighter, or is it just like a bystander?
A regular person.
Family member, someone with no medical training.
Right.
It really like impacts that initial approach.
Yeah, absolutely.
Yeah.
I mean, think about it. If you're a paramedic arriving on scene and you know that a trained professional has already been providing care, that gives you a completely different starting point than if it's a bystander who maybe just called 911.
And it's not just for the paramedics on scene either, right?
No, not at all.
Mhm.
This information is crucial for anyone who might review the report later. Doctors, nurses, quality assurance teams, they all need to understand the context of the situation.
So you're saying it paints a clearer picture
Exactly.
for anyone reading it later on.
It's all about providing a complete and accurate record of what happened.
And here's another thing that I thought was kind of interesting.
Okay.
The report actually like requires documentation of who started CPR,
Uh-huh.
even if a valid do not resuscitate order is in place.
Really?
Isn't that kind of redundant?
It might seem that way at first glance, but there's a really important reason for it. Think of it like this. Every action taken, even if it seems contradictory in the moment, needs to be recorded.
Okay.
This provides a complete and transparent account of the event, which is essential for, legal and medical review. It's not just about following a protocol, it's about capturing the reality of a high-pressure situation.
So even if it seems like, why are you doing that if there's a DNR?
Exactly.
It still needs to be recorded.
It all goes in the report. Transparency is key.
Transparency, yeah.
Gotta have it.
Okay, that makes sense. And speaking of details, the report really emphasizes the timing of everything.
Yeah.
The arrest itself,
Yeah.
the start of CPR,
Yeah.
the first shock, if one was delivered.
Uh-huh.
Why is all that so important? Like, why that level of precision?
Well, put yourself in the shoes of a doctor who's trying to piece together what happened and why. Those timestamps aren't just random numbers. They're vital pieces of data that help medical professionals understand how the event unfolded, the effectiveness of each intervention. Ultimately, it's about learning from each case to improve care in the future. Was a CPR started immediately? Was the first shock delivered within the optimal time frame? These are the kinds of questions that those timestamps can help answer.
So you're looking at those precise times to get a sense of
like
how things progressed, how things happened.
The timeline is everything.
Yeah,
It's
right.
like reconstructing a crime scene, but for medical care.
So we're almost like detectives in a way,
In a way, yes.
using the ACR as our evidence.
Absolutely. And just like detectives, we're looking for clues, patterns, anything that can help us understand what happened and how to prevent similar situations in the future.
Looking for those clues to understand
Mhm.
the patient's condition and how they were cared for.
Exactly. Every detail matters.
Okay. So let's move on to the physical exam section of the report,
Right.
where the paramedics are gathering even more of those clues
Yeah, let's dive into that. This is where it gets really interesting.
about the patient's state. Right.
Exactly.
So it starts with general appearance, which I thought was pretty straightforward,
Oh, I bet.
but there's a surprising level of detail in there.
There is. Paramedics are trained to be incredibly observant. It's not just a quick glance. They're looking for any and all clues that might help them understand the patient's condition.
Oh, wow.
So, for example, they don't just write, "skin is pale." They use specific terms like pallor, cyanosis, or mottling to describe the exact shade and undertones of the skin.
So it's more than just pale.
Much more. These specific terms provide a much richer picture for anyone reading the report later on.
Interesting. So it's not just for them at the moment.
Right. It's creating a record that can be understood by other medical professionals down the line.
And this level of specificity
Yes.
helps to paint a more vivid picture.
It's like painting a portrait with words.
Wow.
They also note the condition of the skin. Is it dry, clammy? Are there any visible injuries? All of this contributes to understanding the overall clinical picture.
So it's really a baseline for comparison, you know?
Precisely.
Yeah.
It's all about establishing a clear picture of the patient's initial state so that any changes can be quickly identified and addressed.
It's amazing how something as simple as skin color
Right.
can be so revealing.
It's a vital sign, just like pulse or blood pressure. It can tell you a lot about what's going on inside the body.
Wow.
And it doesn't stop there. Paramedics also document the patient's mental status. Are they confused, agitated, responding appropriately?
So it's not just physical.
Nope. The mental state is crucial too. It can provide clues about potential neurological issues or the severity of the situation. A patient who is confused or disoriented might be experiencing something very different from someone who is simply in pain.
Right.
And that distinction can guide the paramedics' next steps.
I'm starting to see how each detail kind of builds upon the last, you know,
Absolutely. It's like assembling a puzzle.
to create this more complete image.
Exactly. And that initial general assessment, it's foundational. It
Yeah.
sets the stage for everything that follows. It can point towards a possible diagnosis, help prioritize treatment, and ultimately impact the patient's outcome.
So it's not just checking boxes.
Not at all. It's about gathering intelligence to make informed decisions.
Gathering intelligence.
Yep. Every observation, every detail, it's a piece of the puzzle.
Gotcha. Now the next section is head neck.
Okay.
And this is where things get maybe a little more
A
technical.
little bit, but we'll break it down.
The report mentions checking the trachea position
Uh-huh.
and looking for something called JVD,
Jugular vein distension.
jugular vein distension.
Yeah.
What are they looking for there specifically?
They're looking for signs of trouble, basically.
Yep.
Trouble breathing, trouble with circulation. The trachea, that's your windpipe, should be right in the middle.
Center.
Yeah, if it's pushed off to one side, it could be in a collapsed lung or something, blocking the airway.
Oh, wow.
And GVD, that's when the veins in your neck are bulging.
Okay.
That can be a sign of heart problems, fluid buildup in the chest, things like that.
So these seemingly subtle signs can actually reveal quite a lot.
They're like little warning flags.
Wow.
They tell the paramedics that something might be seriously wrong and help them decide what to do next.
About what's happening internally.
Precisely. It's like having a window into the body's internal systems.
Okay.
They're looking for any sign that things aren't working the way they should.
So they help to like prioritize their actions
Exactly.
based on those signs.
If they see JVD, they might suspect a heart issue and focus on getting the heart pumping effectively. Or if the trachea is deviated, they'll prioritize securing the airway.
So it's like they're
Yeah.
piecing together a puzzle, right?
Absolutely.
Using those observations.
Each observation is a clue. And the more clues they gather, the better they can understand the full picture of what's going on.
to understand the bigger picture.
Exactly.
And then they move on to the chest section.
Right. The chest, the heart and lungs, vital organs.
Yep.
So here, they're really focusing on how well the patient is breathing.
Okay.
They listen for air entry. Is it normal? Or is it weaker on one side? Are there any abnormal breath sounds, like wheezing, crackling, rattling? Those sounds can tell you a lot about what's going on inside the lungs.
So they're not just listening for breath sounds,
Yum.
but the
You're
quality,
listening to the music of the breath.
the music of the breath.
Yeah, is it a clear melody or a distorted one?
Wow.
Each sound has a meaning.
So they're really paying attention to the quality
Absolutely.
and character of those sounds.
You got it. It's about understanding the nuances, the subtle details.
Okay.
It's more than just checking a box. It's about listening deeply.
And the same goes for the following section.
Got it.
Abdomen, back pelvis, and extremities.
Yep. They're systematically looking for anything out of the ordinary in each area.
It's incredible how thorough they are.
They have to be.
It's like they're creating this detailed map
Exactly. A map of the body highlighting any potential problems.
of the patient's body, noting any potential areas of concern.
And all that information helps them make decisions about the best way to care for the patient.
So it feeds into their
Their clinical decision-making, you mean?
yeah.
Exactly. It guides their treatment, helps them prioritize interventions. It's all connected.
Wow. So we've covered the initial assessment, the general appearance, and this detailed physical exam.
They're making good progress.
Now let's move on to what they actually do for the patient.
Okay, the action part.
Yeah. This is where the clinical treatment procedures and results section comes in.
Let's see what they did.
And I'm really curious about this one.
Me too. Assessment is important, but
Right.
action is what saves lives.
Right.
Let's see what interventions they used. This section, it's like
Yeah.
a step-by-step guide to the patient's care.
Okay.
Every little thing they do,
Right.
from giving oxygen, starting an IV, all of it,
Mm-hmm.
it's all documented here. Meticulously.
Using a
Yeah.
standardized system of codes.
Precisely.
And that's what really intrigued me about this this part of the report,
Okay.
It's not just someone writing down what happened.
No. It's much more structured than that. It's a specialized language.
It's very detailed, right?
It is.
It's this like log with codes.
Exactly. And it's designed for clear communication.
It's almost like a secret language,
Well, it's a language that healthcare providers understand.
Okay.
Doctors, nurses, paramedics, they all need to be on the same page, especially in an emergency.
So it's not just about documentation then.
No.
It's about ensuring that, that care continues.
Absolutely. Continuity of care is paramount.
Yeah.
Everyone needs to know what's been done and what needs to be done next.
Can you give me an example of how this
Sure. Let's say they give aspirin.
Okay.
Common for suspected heart attacks, right?
Yeah.
They wouldn't just write gave aspirin.
Right.
No, they use a specific code for aspirin administration.
Interesting.
They note the dosage, the route, was it swallowed or was it given rectally?
Okay.
And the outcome, did the patient tolerate it?
Wow.
Every detail matters.
That's incredibly specific.
It is, and for good reason.
It's like a digital fingerprint almost,
Exactly. And that level of detail ensures accountability, helps catch errors, provides valuable data for research.
So you can go back and trace every action, every
Precisely.
Yeah.
It's a complete record of the care provided.
intervention taken.
You got it. It's all there, black and white.
It's amazing how these reports can hold so much potential
They really do. They're a gold mine of information.
for improving care,
Absolutely.
Yeah.
And we're just scratching the surface here.
Yeah. But what about
Yeah.
what about when there are a lot of interventions?
Right. Like in a complex case.
In a cardiac arrest, right?
Exactly. You might have multiple things happening at once.
They need more space to document all that.
They
Right?
do. And that's where those extra pages come in. The ACR has dedicated space, but in a complex case, they can add pages to document every single procedure.
Wow.
And to keep it all organized, they use the call number page section.
Okay.
Every page, every single one gets a unique number, so nothing gets lost or mixed up. It's like a filing system.
So everything stays in order.
Exactly. A doctor can look at the report and easily follow the sequence of events, even if it's spread across multiple pages.
So it's not just about capturing the details, but also about organizing them.
Right. Organization is key. It's about making sure the information is accessible and meaningful.
So you can connect the dots
Precisely. Connecting the dots between the assessment, the treatments, and the outcome.
between the initial assessment, the interventions, and the patient's outcome.
Exactly. It's all part of building that complete picture.
It's like assembling a jigsaw puzzle.
You got it. each piece of information adds to the overall picture. And in this case, the picture is the patient's journey.
Now, I know we've talked about vital signs before,
Oh, yeah. Vital signs are crucial.
but how are they documented in this section?
Oh, they're in there. All right.
Okay.
And the ACR, it's very specific about how often they need to be taken.
Yeah, I noticed that.
Right. It emphasizes just how important they are.
Huh.
They give you a snapshot of how the patient is doing at any given moment.
So it's not just about like a baseline reading.
Right.
It's about ongoing monitoring.
Absolutely. You need to track those vital signs over time.
Looking for trends,
Yeah.
right?
Exactly. Is the blood pressure going up, down?
Yeah.
Is the heart rate steady? These trends can tell you a lot about how the patient is responding to treatment.
So it's like having this continuous stream of data
It's like a window into the body's internal workings.
that can help the medical team make
Mhm.
more informed decisions.
Precisely. It allows them to adjust the treatment plan as needed based on real-time data.
About the patient's care.
Yep. Vital signs are essential for providing the best possible care.
I never realized how much information
Right.
could be
They're
gleaned
packed with information.
from something as seemingly simple as vital signs.
They might seem simple, but they're incredibly powerful tools for assessment and monitoring.
So they're really a key part of
Yeah.
understanding the patient's story.
They tell a story, those vital signs, a story of how the body is coping, how it's responding to treatment.
And speaking of stories, I think this ACR is starting to paint a pretty vivid picture of what happened
It is, isn't it?
during those crucial moments.
We're seeing the whole picture now. The assessment, the exam, the treatments, it's all coming together.
We've seen that initial assessment,
Yep.
the detailed physical exam, the meticulous documentation of every intervention.
It's impressive, the level of detail they capture.
We've decoded those codes,
Yeah.
connected the dots,
Like a detective novel.
and gained a deeper understanding of how these reports can,
Mhm.
help us learn and adapt and make a difference in emergency medicine.
It's all about learning and improving. That's the key.
But before we wrap up our investigation,
Oh, there's more.
there's one more section of the ACR that I want to explore,
Okay.
the narrative summary.
Oh, the narrative summary.
This is where the paramedics get to tell the story in their own words.
A chance for them to add their own perspective, their insights. I like this part.
Providing context and insights that
Yeah.
might not be captured in the more structured sections of the report.
Exactly. It's where their clinical judgment and experience really shine through.
This narrative summary,
Yeah.
it's almost like reading a detective's notes,
It is. It's where they pull all the pieces together
Right.
and offer their perspective on what happened.
Yeah.
Like, here's what we saw. Here's what we think it means.
It's where they can highlight, subtle details, observations.
Yeah, those little things that don't always fit in the boxes.
Right, exactly.
Things that might not be captured in those standardized sections.
It's where their clinical judgment and experience really shines through.
Absolutely.
I'm curious to see how they weave it all together.
How they connect the dots
Yeah.
between the hard data and their own observations
Yeah.
to create that narrative.
Right.
It's like getting a glimpse inside their heads.
Reading through this narrative summary,
Yeah.
I can't help but feel a sense of the human element,
Oh, absolutely.
behind all those codes and timestamps.
It's easy to forget sometimes that these reports represent real people,
Right.
real lives.
Yeah, it's easy to get lost in the technical aspects, but
Right.
ultimately it's all about using this information to improve care,
Absolutely.
potentially save lives.
That's what it's all about.
And that's
Yeah.
what makes this deep dive so rewarding.
I agree.
We've gone beyond simply decoding the jargon.
Right.
We've gained a deeper understanding
Yep.
of how these reports can be used to learn, to adapt,
To make a real difference.
to make a difference in the world of emergency medicine.
Exactly.
So as we wrap up our exploration
Yeah,
of
yeah.
this ambulance call report,
Yeah.
I want to leave our listeners with a question.
All right. I like questions.
We've seen how detailed these reports are.
Yeah. Incredibly detailed.
But what other possibilities do you see
For
for using this data
Wow.
to advance the field of medicine?
Oh, that's a great question. So much potential.
Yeah.
Imagine, for example, if we could use the data from millions of these reports to build predictive models
Okay.
for cardiac arrest.
Interesting.
We could identify risk factors, maybe even intervene before it happens.
Wow.
That would be incredible, wouldn't it?
Yeah, or maybe we could analyze, the effectiveness of different interventions
Right.
based on this real world data.
Oh, absolutely. That's how we
Yeah.
learn what works best in real-life situations.
Leading to more personalized treatment.
More effective treatment.
More
yeah.
effective treatment protocols.
That's exactly.
Mm.
Tailored to the individual patient.
It's amazing to think about the potential impact
Yeah.
this data could have on the future of healthcare.
It's exciting to think about.
It really is.
So much potential for discovery.
Well, that brings us to the end.
Time flies when you're having fun.
It really does.
Decoding medical mysteries.
Of our deep dive
Mm-hmm.
into the world of ambulance call reports.
It's been a journey.
I hope our listeners found it as fascinating.
Me too, as we did.
I bet they did.
Remember, even the most complex information
Right.
can be broken down,
Mm-hmm.
understood,
With a little help
with a little curiosity and guidance.
and a willingness to learn.
And sometimes the most
Yeah.
seemingly mundane documents
Right.
can hold the keys
Mm-hmm.
to unlocking incredible discoveries.
We really can.
So keep exploring, keep asking questions,
Keep that curiosity alive.
and never stop learning.
That's the key to it all.
All right, buckle up, everybody. We're going behind the scenes.
Behind the scenes of what?
Ambulances. We're doing a deep dive into those reports.
Do you mean those forms the paramedics fill out?
Yeah, the ambulance call reports. You've probably heard of them, but there's a lot more to them than meets the eye.
Oh, I bet. Those things are probably pretty detailed.
You have no idea. We're going right to the source for this one.
The source.
Yep, straight from Ontario, their official guidelines on how these reports should be done.
So we're going to learn how to fill out an ambulance call report?
No. We're going way deeper than that.
Yeah.
We're going to find out why those reports are way more important than they look.
I'm all ears.
Okay, for starters, get this. Each report, it turns into 4 copies.
4 copies? What do they do with 4 copies?
They go everywhere. Hospital, billing office, you name it.
I guess that makes sense. A lot of people probably need to see those reports.
Exactly. And it's not just about keeping everyone in the loop. There's a bigger reason for all those copies.
Oh, and what's that?
It all comes down to this. Those reports, they're not just forms. They're legal documents.
Legal documents. Wow, I never thought of it that way.
Yeah, they're used for all sorts of things, like making sure the billing is correct, even protecting the paramedics if something goes wrong later on.
So like if there's a lawsuit or something.
Yeah, exactly. These reports have long-term consequences.
Yeah.
We're talking legal protection, quality of care, the whole 9 yards. Okay, 4 copies makes more sense now.
Right.
But
Yeah.
legal documents, that's pretty serious stuff. We're talking something jotted down in the back of a moving ambulance.
Well, yeah. And it's not just jotted down, it's got to be super detailed. I mean, think about it. Paramedics are working in crazy situations. Lots of pressure.
Right, but they still have to document every little thing.
Everything. Vital signs, medications, what time they did what. It's impressive how much detail they're expected to record.
It really is. Makes you realize those forms are more than just a formality, right?
Absolutely. It's all about accountability and making sure everything is done by the book.
Speaking of details, there's a whole section in the guidelines about biometric data.
Biometric data.
Heart rate, blood pressure, all that. It makes you wonder, how do they even get accurate readings when someone's in the middle of a crisis?
Well, it's not always easy, but getting that data is crucial. You see, something like an oxygen saturation level.
Yeah.
It could be the first sign of something serious, like a silent heart attack.
Why?
If they miss that on the report, it could have huge consequences for the patient later on.
So it's not just about checking boxes, it's about gathering clues. Clues that could make a difference long after the ambulance ride is over.
Exactly. It's all connected.
It's like each report is a little piece of a giant puzzle.
A puzzle that helps us understand the bigger picture of emergency medical care.
That's pretty amazing when you think about it.
It really is. It all comes down to those paramedics on the front lines, making sure every detail, no matter how small, is recorded accurately.
They're like data detectives. Okay, let's get into the nitty-gritty of these reports. I was surprised to see how much emphasis they put on good old-fashioned handwriting.
Handwriting, really?
Oh yeah, there are all these rules about using block letters and pressing hard on those paper copies. It seems a little outdated, don't you think? In the digital age and all?
I guess so, but you gotta think, those reports could end up in court years down the line.
That's true.
Imagine a lawyer trying to read some scribbled note about a medical decision could be a real problem.
Yeah, good handwriting could make or break a case. It's a good reminder that even with all our fancy technology, sometimes the simple tools are the best.
Absolutely, especially when someone's health or even their legal rights are on the line.
You know what else caught my eye?
Yeah.
There's this rule that if they can't get certain information, they have to write CNO,
CNO, what's that stand for?
could not obtain.
Oh, I see.
And then they have to explain why they couldn't get the information.
Mm-hmm.
Seems simple enough, but I wonder when that would actually come up.
Well, think about it. What if a patient is unconscious after an accident?
Ah, I get it.
They can't tell you their medical history, allergies, maybe even their name.
Right.
That CNO becomes super important for the hospital staff. It's a big red flag that something is missing.
It's like a built-in safeguard.
Exactly.
Yeah.
A way to make sure everyone knows that key information is missing.
These reports are way more than just checklists, aren't they?
Not at all. It's about communication, making sure crucial information gets passed along, even in tough situations.
Okay, one last thing that really stood out to me. These guidelines are obsessed with time.
Time.
Yeah, they're all about synchronized clocks and precise timestamps. They make it seem like every second matters. I mean, obviously it does in an emergency, but why so much emphasis on time?
Well, in emergency medicine, time can literally be the difference between life and death.
Right.
Those timestamps are super important. You need them to reconstruct what happened, analyze response times, even evaluate how effective the treatment was. Imagine a patient whose condition takes a sudden turn for the worse. Yeah.
A few minutes off in the documented time of a key intervention. It could change everything, could impact how everyone understands what happened.
It's like every second is a data point, and all those data points together tell the whole story.
Exactly.
Okay, so we've got legal implications, potential life-saving data, and now a whole forensic timeline element. These reports are way more complex than I ever imagined.
They really are, and we've only just scratched the surface.
Well, I'm ready to dive deeper. Let's get into some of the specific sections of these reports and see what other hidden gems we can find.
You know, there's this one section that always gets people talking.
Oh, which one?
The part about documenting every single ambulance request.
You mean every call they get?
Every single one. Even if they don't actually treat anyone.
Wait, so even if the paramedics show up and don't end up taking anyone to the hospital, they still got to fill out a report?
Yep. It might seem like a waste of time, like just more paperwork, but there's a reason for it.
Okay, I'm listening. Why bother with all that if nobody even got treated? Well, those reports, they're actually valuable data.
Data.
Yeah, data about demand, like how many calls they're getting, what kind of calls, where they're coming from.
I see, so they can track trends and stuff.
Exactly.
Okay.
And identify potential gaps in service. Like, let's say there are a bunch of calls for lift assists at the same address.
Lift assist.
Yeah, like helping someone who's fallen get back up. So if they see a pattern like that, it might mean that person needs some extra help at home.
So it's not just about the individual call, it's about the bigger picture.
Exactly.
I never thought of it that way. It's like those reports are little flags signaling where resources might be needed.
Precisely.
Okay, that makes a lot more sense now. I'm also really curious about the remarks section. It seems pretty open-ended.
Ah, the remarks section. That's where things get interesting.
Oh.
It's where the paramedics can add in all the stuff that doesn't fit in those little boxes.
So like their own observations and stuff.
Exactly. Contextual information. Anything that helps paint a fuller picture of what happened.
I see. So it's like the free response section of the ACR, where they can really flesh things out.
You got it. It can be really crucial. Let's say they get called for a possible overdose.
Okay.
The vital signs might tell part of the story, but the remarks section is where they can add in those extra details.
What?
Did they find drug paraphernalia nearby? Did the patient mention a recent relapse? Those details can make a huge difference in how the patient is treated.
Wow. So the remarks section is where the objective data meets the subjective reality of the situation.
Exactly. It's where the human element comes in. The paramedics can use their training and experience to provide a more complete picture, one that goes beyond just the numbers.
Reading all this, it makes me think about the emotional toll it must take on paramedics to be dealing with these intense life or death situations and then having to document everything so clinically.
Oh, absolutely. They see a lot of trauma, a lot of suffering. It's got to be tough to switch gears and write it all down in this detached, objective way.
It makes you realize there's a whole human story behind each one of these reports.
For sure. It's not just data points, it's people's lives, real people going through some really tough stuff.
And the paramedics are right there in the thick of it. It really highlights the need for support systems for those folks.
You're absolutely right. They need training and support to deal with not just the technical stuff, but the emotional stuff too. It's a tough job.
It really is.
Yeah.
They deserve a lot of credit. Okay, let's move on to something a little lighter. What about those general rules they talk about?
Ah, yes. The general rules. Some of them are pretty obvious, like making sure you fill out a report for every request,
Right.
using black ink, writing clearly. But then there's some more specific things,
Like what?
like using only approved medical abbreviations. There's a whole language they use in emergency medicine.
It's like their own secret code.
Kind of, yeah. But it's important. Those abbreviations ensure that everyone understands what's being said. Doctors, nurses, other paramedics, they all need to be on the same page.
Makes sense. So it's not just about being quick, it's about being accurate.
Exactly. And that means the paramedics need to be constantly learning, keeping up with all the latest terminology and abbreviations.
Medicine is always changing, right?
Always evolving.
You know, I'm starting to see these guidelines in a whole new light. They're not just a bunch of rules, they're like a roadmap.
A roadmap.
Yeah, a roadmap to better care. They're all about ensuring quality, accountability, making things better all the time.
I like that. It's about capturing the important information, sharing knowledge, and ultimately improving how we take care of people in emergencies.
Well said. Okay, we've covered a lot of ground, but I'm ready to see how this all plays out in real life.
Real life examples.
Yeah, let's dive into some specific scenarios from the guidelines and see what we can learn. Okay, so let's get into some of these real-life situations.
Real life scenarios, yeah.
The guidelines actually have a bunch of examples.
They do.
Like what happens if a patient doesn't want to go to the hospital?
Refuses transport.
Yeah, even though the paramedics think they should go.
Interesting.
The guidelines say you got to document everything.
Like what they told the patient.
Yeah, like the risks and all that. And if possible, get a witness to sign off on it.
Seems kind of intense for a refusal.
Right. But they say it's super important.
Why is that?
Well, think about it. What if something bad happens later?
After they refuse transport.
Yeah, and then they decide to sue the paramedics.
Ah, I see. So it protects the paramedics.
Exactly. It shows that they followed the rules, explained everything, and the patient made an informed decision.
It's like a safety net for everyone involved.
Makes sense. You know, these reports are good for a lot more than just medical records.
Oh, definitely. It's all about clear communication and making sure everything is documented properly.
There's another scenario that I thought was interesting.
Yeah.
What happens if a patient gets hurt in the ambulance?
In the ambulance. How does that happen?
Well, it could be anything. Sudden braking, sharp turn. Maybe they just fall off the stretcher.
Oh, wow. I never thought of that.
The guidelines are really specific about documenting that kind of stuff. How the injury happened, what they did about it. It made me wonder, does that happen very often?
Accidents during transport, thankfully it's not super common,
Right.
but it does happen. And when it does, it's important to have everything on record.
I guess that makes sense. But why so much detail?
Well, first of all, you want to make sure the patient gets the right follow-up care.
Okay, yeah.
But it's also about safety. Analyzing those incidents can help them make things safer inside the ambulance, prevent future accidents.
It's all about learning and improving.
Exactly. They use those reports to make things better for everyone.
So it's like a safety net, but also a tool for improvement.
I like that. A safety net and a tool. A good way to put it.
Well, I think we've successfully gone behind the curtain
Behind the curtain.
of ambulance call reports. They're a lot more important than I ever realized.
Me too. It's amazing how much goes into those seemingly simple forms.
So next time you see an ambulance racing by,
Sirens blaring.
yeah, you'll have a whole new appreciation for the paperwork trail that follows. It's about more than just filling out forms. It's about capturing those crucial details. Every timestamp, every observation, it all matters. And it's all thanks to the paramedics who are out there, on the front lines, making sure those reports are accurate and complete.
They are the unsung heroes of emergency medicine. They have a tough job, and they do it with skill and compassion.
Well said. Those reports are a testament to their dedication. And they remind us that behind all the data, there are real people with real stories.
Absolutely. And those stories deserve to be told with care and precision.
Well, that's about all the time we have for today, but I want to leave you with something to think about.
A parting thought.
Yeah. We've talked about the pressure, the legal stuff, the emotional toll. So what qualities do you think are most important for a paramedic to have when they're filling out one of these reports?
That's a great question. It really makes you think about everything those paramedics are dealing with.
Thanks for joining me on this deep dive. We'll see you next time. All right, so today we're taking a deep dive into the world of emergency medicine.
Oh, interesting.
And specifically, those reports that paramedics put together before the patient even gets to the hospital.
Okay.
We've got some excerpts here, and we're going to be focusing on the clinical information section, which really sets the stage for everything that happens next.
Yeah.
Whether you're, interested in how medical stuff works or you just love a good detective story.
Yeah.
Understanding these reports is, well, it's surprisingly fascinating.
Yeah. They really are like a puzzle, these reports. Each piece is giving crucial information,
Yeah.
They're the foundation for the entire medical team.
Okay, so let's dive into the first piece of this puzzle.
Okay.
Date and time.
Right.
Now, I know, that seems pretty basic.
Yeah.
But in a medical emergency, why is it so important to have that precise timing?
Well, just imagine someone's having chest pain after shoveling snow, right?
Right.
Knowing exactly when that pain started, that helps doctors connect the dots. Was it right after they were working hard, or did it come on slowly?
Oh, okay.
Those little details can actually point to different pauses.
Wow.
And that, of course, changes how they treat the person.
So it's not just, like, paperwork.
No.
It's a vital clue.
Exactly.
That's really interesting. Okay, now let's move on to the chief complaint section.
Okay.
I'm guessing this is where we really get the patient's perspective, really.
Absolutely. It's all about capturing their experience in their own words. The report emphasizes using clear language, like chest pain after shoveling snow,
Right.
instead of just medical jargon.
That makes a lot of sense, especially in those initial moments. Now, speaking of painting a clear picture, we have the incident history section. And this seems to be where the story really starts to unfold.
Exactly. This is all about context, right?
Yeah.
It's like the detective work phase. Our excerpt here, it talks about a patient shoveling snow for like 45 minutes.
Yeah.
The pain going down their left arm, a pain level of 6 out of 10.
Okay.
Even that they didn't have shortness of breath, that's important too.
Right.
Each detail adds another layer.
Yeah.
Helps guide those paramedics.
Wow. So it's not just what the patient says, it's also like observations, the environment,
I
everything.
got it. Every little thing matters.
That's fascinating how much information is packed in there. Okay, let's shift gears a bit
okay.
to something maybe a little more sensitive.
All right.
The MOHLTC DNR confirmation no.
Right.
This is about honoring a patient's wishes ahead of time, right?
It is respecting their autonomy.
So DNR, that stands for Do Not Resuscitate.
Yes.
It's a legal document outlining those choices about life-saving measures. But what's the deal with a confirmation number?
Yeah.
And why is it documented even if, a cardiac arrest doesn't happen?
Well, that unique number ensures there's no confusion.
Right.
It's very clear about the DNR. And documenting it in every report, even if resuscitation isn't needed, it just emphasizes that commitment to the patient's wishes.
Okay, so it's about respecting their autonomy throughout the whole journey, not just in that one moment.
Exactly.
That's really impressive, that level of detail. Okay, let's get into something a little more, I guess, technical.
Sure.
Trauma problem site type. We're starting to get into coding here, right?
Not medical codes exactly, but how we categorize injuries in a standardized way. Like,
Okay.
take a knife wound to the chest.
Okay.
It's broken down by location, chest type, penetrating, and mechanism,
Right.
stabbing.
So 3 codes paint a very precise picture.
They do for other medical staff. And the report can handle multiple injuries, too.
Oh, so it's not just limited to one thing at a time.
Right, it can document up to 3 main problems,
Oh.
with more details going elsewhere if needed.
So it's structured, but it's also adaptable.
Exactly, designed for all sorts of situations.
It's amazing how they make it so thorough but concise.
Oh.
All right, moving on to relevant past history. I imagine this is where things get really personalized.
Absolutely. It's all about adding layers to our understanding of the patient. Past illnesses, surgeries, medications, allergies.
So they're connecting the dots.
It is, between their medical history and the current emergency. And they've got a system for capturing all this.
Totally.
Checkboxes for common stuff.
Right.
Free text areas for specifics.
Okay.
Even notes on medication forms, spray, tablet,
Wow, they've really thought of everything.
Oh.
Okay, allergies seems pretty straightforward, but I bet there's more to it than just a yes or no, huh?
You're right. Specificity is key here. It's not just if they have allergies, but how they react. What are the symptoms?
Oh, that makes sense.
Ah.
And I see they clarify the use of NKA.
No known allergies.
All right, for our last bit here in this section, let's unpack treatment prior to arrival.
This captures anything done before the paramedics get there. Bystanders, first responders, anyone.
So even if someone just repositioned them, that matters?
It does. It all influences things, and the report mentions that longer notes go in the remarks section.
Oh, so there's even more detail lurking there.
There is. Gives a really complete picture.
Is incredible. I'm already amazed by how much information is packed into this one section.
It's a lot, right? And we're just getting started.
I know. I can't wait to see what else these reports reveal.
Well, stick with us as we explore more of this fascinating world of pre-hospital care reports in the next part.
I definitely will.
Great.
This is too interesting to miss.
I agree.
All right, we'll be back in a bit.
Sounds good. Welcome back to our deep dive into the world of pre-hospital care reports.
We're picking up right where we left off, still exploring this clinical information section.
It's amazing how much is already gathered before they even get to the hospital, right?
I know, it's like they're building a foundation for the patient's care before they even arrive.
Exactly, making sure everyone has a clear picture of what's going on.
Okay, so last time we talked about those initial actions taken before the paramedics get there.
Right.
But now let's talk about what happens when they actually arrive on scene. What about this vitals section?
This is where we get that first glimpse into the patient's physiological state, right then and there.
Okay.
Like taking a snapshot of their vital signs.
So we're talking blood pressure, heart rate, respiratory rate, that sort of thing.
Exactly. Those are all key indicators of how the body's doing. And the report captures not just one reading, but often multiple readings over time.
So you can track any changes.
Right, and spot trends that might be concerning.
Makes sense. So it's not just the numbers themselves, but how they change.
Exactly, like a steadily dropping blood pressure could indicate internal bleeding, for instance,
Oh, wow.
while a rapid heart rate might suggest the body's struggling to compensate.
So each vital sign is like sending a message.
That's a great way to think about it.
Okay, now what about this Glasgow Coma Scale, or GCS? It sounds kind of intimidating.
I know, it sounds complex, but it's really just a standardized way to assess a person's level of consciousness.
Okay, and this is especially helpful in cases of, like, head injuries.
Yes, or any potential neurological issues. Basically, the paramedics look at the patient's eye-opening, verbal responses, and motor responses, and they give a score for each category.
So the higher the score?
The more alert and responsive they are. A perfect score is 15, meaning they're fully awake and oriented.
Got it.
While a score of 3, well, that's just a deep coma.
Okay, so the GCS score helps paint a picture of how the brain is functioning.
Precisely.
Speaking of observing things, the report also mentions pupils. I'm assuming we're not talking about elementary school here.
Uh-huh. No, not this time. We're talking about those black circles in the center of our eyes.
Right.
And believe it or not, their size and how they react to light, that can tell us a lot.
Really? Like what?
Well, for example, if the pupils are dilated and they don't constrict when exposed to light, that could indicate a head injury. Or maybe drug use. Unequal pupil sizes might suggest pressure on the brain.
So even subtle changes can be important clues.
Absolutely. Paramedics are trained to pick up on those nuances.
Wow, it's amazing how much information you can get just from looking at someone's eyes.
It is, isn't it?
Okay, let's move on to the respiratory section. Seems pretty self-explanatory, but what exactly are they looking for when assessing someone's breathing?
It's more than just counting breaths per minute. They're looking at the rhythm, the depth, the effort of each breath.
Okay.
They listen for any abnormal sounds like wheezing or crackling, which could mean there's a problem in the lungs.
So it's a multifaceted assessment, not just a quick count.
Exactly. And of course, they're also measuring oxygen saturation, how well the blood is absorbing oxygen.
Yeah, and of course. So it's like having a window into the lungs.
You got it.
All right, moving right along to cardiovascular. This is all about the heart, I presume.
That's right. This section focuses on the heart and the circulatory system. Paramedics listen to the heart rate and rhythm, paying close attention to any unusual sounds, like murmurs or gallops, which could suggest there's an underlying problem with the heart.
So they're basically acting like on-the-spot cardiologists.
In a way, yes. They're also looking for any signs of circulatory issues like swelling in the extremities.
Right.
All this helps them assess blood flow and determine if they need to intervene right away.
It's like taking a pulse on the entire cardiovascular system.
Exactly.
Okay, now I'm curious about the abdomen section. What's involved in assessing the abdomen in a pre-hospital setting?
Well, they'll gently palpate the abdomen, feeling for any tenderness, distension, or unusual masses.
Okay.
They'll also listen for bowel sounds, which can tell us about the activity of the digestive system.
So it's like a quick checkup on the belly.
Precisely. Exactly. And of course, if the patient has abdominal pain, this helps pinpoint the source.
It's amazing how every part of the body tells a story.
It really is.
Okay, let's move on to musculoskeletal. I imagine this is all about looking for broken bones and such.
That's a big part of it, but it's actually more comprehensive than just checking for fractures.
Oh,
They're assessing the entire musculoskeletal system, looking for any deformities, swelling, tenderness, or limitations in range of motion.
so they're essentially scanning the body's framework for any signs of damage.
Yes. Think of it as a head-to-toe assessment of the bones, muscles, and joints.
Wow, it's like piecing together a puzzle, with each section of the report providing a different piece.
You got it. And we're not done yet. There are still a few more vital sections to explore.
This is fascinating. I can't wait to hear what else these reports reveal.
Well, let's dive into the final part of our exploration in the next segment.
Welcome back, everyone. We're in the final stretch of our deep dive into these pre-hospital care reports. And I got to say, I'm feeling like an honorary paramedic at this point.
Well, you never know. You might start taking pulses at the dinner table after this.
But seriously, the level of detail in these reports is incredible. Like, every section plays a crucial role in understanding what's going on with the patient.
It's like a symphony of information.
Exactly. And I think we have a few more movements to explore in this symphony. Let's start with the neurological section.
Ah, yes, the brain. Always a fascinating area.
It is. So what kind of assessments are we talking about here?
Well, this section goes beyond that Glasgow Coma Scale we talked about earlier.
Right.
Gives a more complete picture of how the nervous system is working. Paramedics look at things like the patient's level of consciousness, how oriented they are, their speech patterns, their coordination.
So they're looking for any signs that something might be off with the brain or the nerves.
Exactly, any red flags. The report also mentions any abnormal movements, seizures, signs that might suggest a stroke.
It's amazing how they can make such detailed observations under pressure.
They're highly trained. It's impressive.
It is.
Yeah.
Okay, what about mental status? Is this where we get into the emotional and psychological side of things?
That's right. This section is all about the patient's mental and emotional state. Paramedics are looking at their mood, affect, how their thought processes are working, even their judgment.
So it's not just about physical health. They're taking into account the whole person.
Exactly. They're trained to look for signs of anxiety, depression, even psychosis.
Wow, so they're really considering everything that might be going on.
They have to. It's all connected.
It really is. Okay, let's get a little more technical. What about this 12-lead ECG interpretation section?
This is where the paramedics put on their cardiologist hats.
Okay.
An ECG, or electrocardiogram, it measures the heart's electrical activity.
Right.
And a 12-lead ECG, well, that gives a very detailed view of how the heart is functioning.
So they're analyzing those, squiggly lines we see on TV.
Exactly. And the report includes their interpretation of the ECG, which can show things like an abnormal heart rhythm, problems with blood flow, even issues with how the heart muscle is working.
So it's like having a portable cardiologist right there on the scene.
In a way, yes.
That's incredible. Okay, let's talk about medications administered. This one seems pretty straightforward.
It is, but it's also really important for making sure the care is consistent.
Right?
This section documents every medication given to the patient by the paramedics.
Okay.
The name, the dosage, how it was given, the time, it's all there.
So the hospital staff knows exactly what's been done.
Exactly. No surprises or oversights.
It's all about communication and teamwork.
Couldn't have said it better myself.
Okay, we're down to our last section, remarks. What kind of information goes in here?
Think of it as a place for any extra details that don't fit in those other categories.
Yeah.
Could be observations about the scene itself, any communication they had with medical control, anything unusual about the call.
So it's like adding context and insights that might not be obvious otherwise.
Exactly. It lets them paint a complete picture.
Well, we've really covered a lot of ground today. I'm honestly blown away by how much goes into each of these reports. It's really impressive.
It is. It speaks volumes about the skill and dedication of these paramedics.
Absolutely. This deep dive has given me a whole new understanding of how complex emergency medicine is and how important these reports are.
I'm glad to hear that. Remember, these reports are more than just paperwork. They're like a lifeline of information.
Yeah.
They guide the medical decisions, make sure the care is consistent, and ultimately they help save lives.
So the next time I hear an ambulance siren, I'll be thinking about all the amazing work those paramedics are doing.
Me too.
Not just providing immediate care, but also creating these detailed records that will help the patient in the long run.
It's all connected.
It is. Thanks for taking us on this fascinating deep dive. I've learned so much.
My pleasure. Always happy to share this knowledge. And until next time, keep exploring, keep learning, and remember, knowledge is power.